We'll go ahead and get started. I call to order the meeting of the Manassas Park Governing Body for February 2nd, 2021. Per the General Assembly's approval of the Governor's amendments to the biennial budget, the governing body may now meet electronically without a quorum actually assembled in a single location and without the in-person governing body members voting on the participation of those who are remoting in. The following benchmarks for the meeting this evening have been met. First, the governor has declared a state of emergency for the current COVID-19 pandemic in accordance with Code of Virginia. Second, the declared emergency makes it impractical or potentially unsafe for the governing body to assemble in a single location, and guidance from state and federal government support this determination. Therefore, the governing body will be meeting with various members participating electronically through GoToMeeting. Third, the meeting is to discuss or transact the business statutorily required or necessary to continue operations of the governing body. Fourth, the governing body will make available a recording or transcript of the meeting on its website in accordance with Code of Virginia. Fifth, notice has been and will continue to be provided to the public using available methods. Lastly, we have made and will continue to make arrangements for public access through electronic means, including the ability to comment. Those participating electronically are Councilmember Darrell Moore, Councilmember Hasib Javed, and Vice Mayor Banks. Those participating in person are Councilmember Yessi Amaya, Councilmember Laura Hampton, Councilmember Alana Mensing, and Mayor Jeanette Rischel. Okay, moving on to approval of the agenda. Are there any changes to the agenda for this evening? Okay. Hearing none, do we have a motion to approve?
Moved.
Second.
All in favor?
Aye.
Aye.
Opposed? Abstained? Motion carries. Next, join us in a moment of silence. And Councilmember Amaya, would you lead us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Moving on to public comment time. Is anyone signed up to make public comment? Okay, and we have not received any emails or any messages over Facebook, is that correct? Okay, thank you. Seeing no one and hearing nothing, we will move on to our information time, which is Dr. Ansher from the Prince William Health District. Welcome, Dr. Ansher.
Thank you. Thank you for having us. We're really pleased to be able to present to you. I am not sure even people who have worked with us for many years understand everything that the health district provides the community. Next slide, please. Okay, the Prince William Health District is dedicated to promoting optimum wellness, preventing illness, responding to emergencies, and protecting the environment and the health of our residents. We oversee the population of Prince William County, Manassas City, and Manassas Park. Our vision is a community of healthy people and a healthy environment. Next slide, please. Public health is a science of protecting and improving the health of entire populations through the promotion of healthy lifestyles, disease and injury prevention, and the detection and control of infectious diseases. Our focus is generally prevention, and public health professionals try to have their impact by educating, by understanding health issues that are unique to our community and may not be consistent with what's going on in Virginia, and recommending policies and providing services and conducting research. Next slide, please. These are some of our services. environmental health services, community health services, population health, emergency preparedness and response, epidemiology, and vital records. And we're going to go into more detail about these services so you can understand. I'd like to introduce Patrick Jones. He's our environmental health manager, and he's going to talk a little bit about his programs. Patrick?
Yes, I'm here. Good afternoon, good evening. Can you all hear me okay?
Yes.
Yes, sir.
Thank you, Dr. Asher. Good evening, Madam and members of the board. My name is Patrick Jones, Environment Health Manager. As Dr. Asher mentioned, we have, in Environment Health, we have two different divisions. First, the Consumer Service Division programs, which inspects the restaurants, hotel, motels, bed and breakfast, daycares, nursing homes, group homes, mobile units, temporary events, and others throughout the county. We also do complaint investigation, foodborne outbreaks. We do a lot of education outreach to some of the food works and handlers of the county. And we have really a robust reviews of prevention program. We're working with the 3 local animal control divisions, especially one in Manassas Park. Numbers there have been on the rise the past couple of years. We had over 800 bites countywide last year. And but working with the 3 different animal control divisions has definitely been great. We also have a number of different environmental complaints, health and safety minutes. That comes into place if we have complaints dealing with environmental. We work very close with different code enforcement divisions just to get compliance from the health department. If we need something, the health and safety minutes, that will actually cause us to take further action a lot quicker. Next slide, please. We also have a division called on-site well and septic programs. We don't have a lot of private wells in the Manassas Park area. We have a few that's been around that maybe used for irrigation or something of that nature. But in that program, they do a lot of evaluation, issue permits for wells and septic systems. We have approximately over 50,000 septic systems within the county. Dealt with that when it comes to wells. Some properties have more than one well. We also have the new alternative on-site system. That's a new design. Technology has improved over the years where they can take a smaller space to install these systems to make you need more space to enjoy your property. We also, in that division, oversee the massage establishment throughout the county. And we do a lot of monitoring of discharge units where we work close with DQ. That's where it comes into play when we monitor sewage disposal systems. We do a lot of outreach in the neighborhoods, work very close with the zoning department building. We have a chest bay pump out system in place for the county where residents are required to pump the system every 5 years. And we have a database that reminds them, we send out notices and follow with them. So that's one of the education outreach that we do provide through our customers. Also in this program now we have gone all electronic files for the on-site well and septic program. You can actually go on the website and look up your property. It can give you all the different documentations about your well, about your septic system, when it's installed, your depths, all things you might need to get repairs and anything of that nature. Next slide. These are some other programs. Dr. Ashley, did you want to chime in here with some of these programs, or do you want me to
Yes, thank you. I think Linda Woods, I'd like to introduce Linda Woods. She's our nurse manager, and she's going to talk about the next few slides.
Good evening. Can you hear me okay?
Yes. Yes.
Okay. All right. So a lot of times folks look at the health department and think about that we give care to the poor or the vulnerable in the community, which is true. But we really are concerned with the health of all residents in the community. And so a listing here of some of the things that we do in order to promote a strong start in life for babies. We have reproductive health life course planning where we try to encourage folks to have a plan and to be healthy with respect to their reproductive health. We do communicable disease education, diagnosis, investigation, and treatment, contact investigation, and community consultation. And those programs that we consult on: sexually transmitted infections, tuberculosis, and latent tuberculosis infections, emerging infections, other 24-hour reportable communicable diseases such as hepatitis A and others. We also look at environmental exposures like high lead levels. We investigate those. We do a lot of education in the community and with our healthcare providers and community-based organizations and with respect to communicable disease prevention. We have our immunization programs, also communicable disease prevention. We do newcomer health screening for folks that are coming in as refugees to ensure that they get a healthy start as they're coming into the country. We screen for communicable diseases and refer them to primary care as we deem is needed. We also do long-term care support services screening. So folks that require long-term care, whether it's nursing home placement or in-home care, we do assess those working along with social services for the adults that we screen. We also screen children that may have some developmental needs or medical needs that require extra care. We do community health assessment and to inform our community health improvement plan, which I believe Dr. Ansher will speak to later. You've heard about our environmental programs, and we also look at emergency preparedness, which I think Dr. Ansher will talk about in a little bit. Next slide, please. Another program that we put a lot of time into actually is our Women's, Infants, and Children program, the WIC program. That's a supplemental nutrition program for low-income, pregnant, breastfeeding, non-breastfeeding, postpartum women, as well as infants up to age 5. It's nutrition education, breastfeeding promotion support, referrals to other services as we see the need. And WIC it's an evidence-based program, and it improves birth outcomes for both the mom and the baby. It also is something that folks don't think about it. It brings millions of federal dollars into our community from healthy food purchases from our clients at the grocery stores. The current emergency that we're in, public health emergency, we've seen a real increase in our WIC services. We averaged last federal fiscal year 20, we averaged about 7,063 participants. We're up more than 8,000 average participants for this so far in this fiscal year. So it's truly filling a need in the community, especially now. Next slide, please.
Okay, I'm going to talk a little bit about our population health division. And we have, the health district has started, along with some community partners, a coalition which has really focused on population health in our entire jurisdiction. And some of the founding partners are the hospitals, the two local hospitals, Centera and Novant UVA. Also, the federally qualified community health center. The French Limb Health District and the Potomac Health Foundation. And what we, our community health assessment, you may remember that was a requirement of became a requirement of hospitals with the Affordable Care Act. And initially what had happened is each of the hospitals were doing theirs separately. They came up with the same information. We had to participate in both. Unmuted. Them all together into this coalition so we could benefit from each other's knowledge and expertise and have one document that will address the health issues in the entire community. We've done this 3 times. On this 3rd time, we were really proud of the community. Part of what we do is we look at data and analyze the data on various health issues. And we also did town hall meetings to ask people in the community what public health issues did they think was most important for us to address. Additionally, we sent out a survey to the public to get that same information. And then we sat down with many community partners who we anticipate would help us as we developed our community health community health improvement plan, and work with us on that improvement. And why we're so pleased with the community, it was clear that we finally got the message across that there's more to health than just access to health care, that where people play, live, get education, work, can all impact your health. And in fact, as well as your socioeconomic condition. In fact, it's estimated access to healthcare only plays about 10% of a role of how healthy a population is. Next slide, please. So some of the other things the coalition does besides the community health assessment and the community health improvement plan, we also have all chipped in to continue to have this Be Healthy, Be Happy principle data dashboard. If you need data or information comparing Manassas Park to other jurisdictions similar to Manassas City, to what's going on in the county, to what's going on in Northern Virginia, and how our health issues may compare with other Northern Virginia communities, it's an excellent resource that puts a lot of data all in one place. It also goes into socioeconomic data and how that impacts health. In addition, we have a copy under local reports of our community health assessment and the development of our community health improvement plan. Unfortunately, as COVID became such a main issue, it sort of has derailed us moving further forward with our work groups. Next slide, please. Ultimately, what the community encouraged us to work on was number 1, marketing, outreach, and advocacy, that we should use this coalition to advocate to our local elected officials regarding laws and commenting about potential laws or regulations that may impact people in our community positively or negatively. We also, as a coalition, have offered our legislators that we would help provide data for and research data for issues that they were concerned about. Educational opportunities was a second priority that a work group will work on, and neighborhood and built environment. We had already provided a grant to look at a particular neighborhood that borders the county and Manassas City that needed to be renovated, but we wanted it to be renovated in such a way that it encourages healthy activity, socialization, and etc., to make our that particular community a healthier community. Generally, the community health assessment and the community health improvement plan is a multi-year process. And after we do our work, which unfortunately won't be moving forward as rapidly as we had hoped, we'll then go ahead and reassess the data to see if we have some improvements in our health. We've also provided our network of community entities, nonprofits, etc., a training in health equity and equity in general, and how to use an equity focus when you're looking at or developing policies, procedures, etc. And so we're in the middle of our first cohort of this very special program. Next slide, please. Our emergency planner, unfortunately, is presenting at another meeting, so I'll present. I think everybody's quite clear. One of the big issues emergency preparedness and response prepares for and responds to is emerging public health issues. Right now, of course, COVID is a huge public health issue, and we're working with our partners to respond to COVID. Initially, it was with not only getting information out, but also doing the contact tracing, the case investigation, as well as put together the testing task force that has allowed COVID testing for free to be offered around our entire jurisdiction. We've done this in partnership not only with our 3 jurisdictions, but also with the hospitals providing us the laboratory support that we need. Additionally, next slide, please. We have a cadre of volunteers called the Medical Reserve Corps, and these have been essential to this COVID response. A large number of our volunteers are nurses that are vaccinators. And we, as you know, in order to get the vaccine out, the more vaccinators we have, the more people we can vaccinate in a point of dispensing site at one time. We have really leaned upon the school nursing staff, in addition to our public health staff, to provide vaccinators for our point of dispensing sites where we provide the vaccine. Additionally, even though it's called a Medical Reserve Corps, any type of individual with any type of skill set can volunteer, and we use all their skill sets, particularly in the point of dispensing site, post-vaccine observing individuals for untoward effects of the vaccine, to registering staff, to flow control, etc. So anybody, we need all kinds of volunteers. But when there's not a emergency event occurring, we also use these volunteers to educate the community or get information out to the community. As an example, if we had, we were notified about a rabid raccoon in a particular area, we would use the Medical Reserve Corps volunteers to go out in the community, perhaps put out flyers, perhaps offer information, so that we could identify people who may have been in contact with the rabid raccoon and get them in for a life-saving vaccine or a vaccine against rabies. When during the summer months when mosquitoes become an issue, they help us go out and about along with some of your staff, and go into communities and educate them about not having standing water and ways to prevent standing water. So they're really a valuable resource. They help with medical surge and have saved lots of dollars from helping us not have to pay for contractors to bolster our medical surge. Next slide, please. And Linda's going to talk a little bit about our epidemiology program. Linda? Linda, you're on mute. Can you unmute?
Can you hear me now?
Wait a second.
All right, now can you hear me?
Yes.
Is she logged in twice? That happens sometime if someone both calls and remotes in over a laptop.
It's hard to, I don't think she's in twice.
Okay, can you hear me now?
Yes, that's perfect.
Does that work?
Yes.
Okay, so I'm sorry. Our field epidemiology program, we work with many partners in the community, including hospitals, medical providers, schools, first responders, the government agencies, and anybody in the community to conduct surveillance and investigation of diseases of public health concern. We implement control measures to reduce the morbidity and mortality from those health concerns. We also inform and educate partners about emerging public health issues that affect the community, and in addition, the National Capital Region, since we are regional. We cross borders so much here. We do act as a liaison between our partners and the Virginia Department of Health. We represent the district on hospital and local government infection control committees. We perform surveillance, as I said, we collect data and monitor the health of the community as a whole. And we work with local and state partners to encourage comprehensive disease prevention. So we get pretty busy trying to keep the community healthy.
Next slide, please.
Types of disease investigations. Patrick mentioned, and Dr. Ansher mentioned rabies and animal bites. We work with other agencies and environmental health. We, in the community health services side, deal with the people part of it, whereas environmental health deals with the animal part of it when we're talking about animal bites. Foodborne illness complaints, unusual occurrences in the community of health issues, and disease clusters or outbreaks. If we notice several cases of a particular disease, we will investigate and determine the best way to mitigate that. Next slide.
Our next presenter will be Anika Wilson. She's our business administrator. Anika, are you on? Anika, do you need to unmute?
Good evening, can you hear me?
Yes, thank you.
Okay, great, thank you. Hi everyone, just wanted to touch base regarding our vital records services that we provide. Vital records consist of birth and death certificates and marriage and divorce records. We do provide this to the community and through our office, which is open Monday to Friday from 8 to 4:30. Currently, due to COVID, we are doing the appointments. So people just need to call in and set up an appointment, and then they can get any type of record that they need. The cost for the search per record is $12. So if we do a search and no record is found, we can issue a letter, but that cost would still be $12 for that search. Vital records are only available to immediate family members, so mother, father, current spouse, child, brother, sister, and grandparents, and you have to have a valid ID in order to obtain the vital record. Next slide, please. Just some general information regarding vital records. Again, we do birth and death certificates, marriage records, and divorce records. Birth records are public information 100 years after the event, and death, marriage, and divorce records are 25 years after the event. We do not do genealogy searches. Unfortunately, we have limited resources, but you can contact the Library of Virginia for assistance with that. And then we have our Vital Records office in our central office in Richmond that assist with more complicated situations, adoptions, foreign adoptions, gender reassignments, and things like that. And I've included that information on the slide as well.
And one of the things I wanted to add, you can go to the next slide, that's fine, thank you. One of the things I wanted to add is when a funeral home cannot get a death certificate signed by a clinician, we're the next stop. I'm the next stop where I try and assist the funeral home in getting the death certificate signed so that people can bury their loved one in a timely fashion. That's another, I don't want to say service, but sometimes, unfortunately, I'm contacted to do that service. This is a list of our locations, they're all on our website, so you can see the Manassas Clinic does clinical services, as does the Woodbridge Clinic. The on-site sewage is in the Development Services building of the county. The Consumer Services is in our business office building, or it's actually has mixed divisions. Teo Circle has the Consumer Services, has the business office, also has the emergency preparedness folks. And then we have two separate satellite WIC sites besides Woodbridge, one in Manassas, a Manassas office on 234, close to 234, near the hospital, and one other in Georgetown South. And thank you, and we're open to any questions you may have.
Thank you very much. That was a very complete presentation. Let's start here. Councilmember Amaya, do you have any questions?
No questions.
Okay. Councilmember Mensing.
Yes, thank you. I have a couple questions. What is the closest COVID testing site to Manassas Park?
I think, Manassas Park Community Center twice a week has testing. They may be temporarily more involved in vaccination. That might be a key. Are they doing testing also?
So the community center itself is doing vaccination right now, but they are doing testing at the MAP clinic.
Oh, okay, cool. Thanks.
Okay. Other than that, on the Prince William Health District website and the county website, and I believe the city's website, are the schedules for COVID testing. We, in spite of the vaccination effort, we've purposely, as a testing task force, which includes Manassas Park, Keith is on it, we have purposely continued to make every effort to continue to have testing in the community because we understand how important it is.
Thank you. And what is the procedure for someone who wants to sign up to get the vaccine who's currently in one of the eligible categories?
I want to be quite honest. 1A, which is healthcare providers, and the long-term care facilities are being taken care of by CVS and Walgreens, as well as the assisted living. 1B, we are not at the point where we are able to do, or anybody in the state of Virginia has moved beyond the first three priority groups in 1B because of the limited vaccine and the large need in that group. Additionally, folks 75 and older and 65 and older have been added by the governor, as well as 16 to 64 that have high-risk medical conditions. What one would do is, if they're not in the 1A category, on the website, there's a link to fill out a survey. And right now, unfortunately, we do have a wait list like every other jurisdiction in Virginia because of the limited vaccine. Northern Virginia as a whole is only getting 39,000 vaccines. That includes both Pfizer as well as Moderna. The Prince William Health District, because we are 6% of the population, we are only receiving 2,975 doses of Pfizer and 3,100 of Moderna a week. This has to cover our hospitals, our private sector partners that are doing vaccinations, as well as the health district pods, as well as the Manassas Park Community Center pod. So you can imagine it doesn't go a long way. We have elected to provide Novant Hospital with all our Pfizer vaccine so that they can, at this point right now, vaccinate all the school employees of the 3 jurisdictions. Originally, Inova was slated to do that because they could do very large number of individuals can be throughput in one clinic. But because of the limited vaccine, they could not follow through completely. They just didn't have access to the vaccine. We've elected to provide Novant, who's been supporting this effort, but because it's only 2,925 vaccines a week, it has to be done over several weeks.
Okay. And when people 65 and up have to fill out the survey, are they required to have an email?
If they are not required. If they do not have technology, we have a call center, and I can get my bag and get the number of the call center, or I'm sure Keith has the number for the call center handy. They call the call center and someone will help them sign up.
Okay.
And then they will be called, if they're on a wait list, they will be called when their appointment occurs.
Thank you.
And at the actual pod site, they will be assisted in obtaining their second dose appointment.
Okay. And my last question is, how long is the wait list?
Last I knew, there was on the wait list about 25,000 people.
Okay, thank you.
We prioritized people who are getting second doses, as well as beyond the healthcare, as well as folks 75 and older, and then 65 and older, understanding that age does impact morbidity and mortality with COVID infection.
Okay, so they're getting bumped up higher on the wait list than someone else would?
Yes, ma'am.
Okay, thank you.
Councilmember Hampton?
I think Keith had a...
Just for the group, the call center is 703-872-7759. Again, that's 703-872-7759.
Thank you.
Thanks.
Thank you.
I have a quick question. In the presentation, you mentioned an increase in bites in Manassas Park. Do you know what that's attributed to? Is it loose dogs? It's raccoons and other type of increase in population vermin?
Patrick, are you there?
Yes, I'm on. Yes, most of it was wildlife. In some areas, from raccoons was one of the tops in the area. I'm trying to think of the numbers. It was throughout the whole county there's an increase, but not a slight increase in that part of the town, Manassas Park. But most of it, if I think about wildlife, is raccoon related.
Okay, thank you.
Your questions, right? Okay.
Thank you. Councilmember Moore, do you have any comments or questions?
First of all, I want to thank the presenter for the excellent presentation. I did have a question about mosquito abatement. And if someone can just explain to me what the process is, do they spray, do they come out? How do they handle mosquito abatement? Is that based on people calling in to complain, or just how one can get that service?
Yeah, I'll kick off out there. Should be everything to add. Normally, they call in a complaint. It will either start with a stagnant swimming pool in the backyard, or they may have something, just complain about a neighbor leaving out containers in my whole water. But one of the things I know out there, as you mentioned with MRC, we'll go to the site and do what we call a survey, tip and toss. Just kind of do a assessment of the property and kind of do more of an education outreach, and point out things like, well, whole water, like flower pots, toys, things of that nature. So normally calls come directly into our office. We also, there's some parts of Manassas Park where we connect with the county. They will come out if there's a positive case when it comes to West Nile. There's some areas where they collect throughout the different parts of the county, and they will do some treatments on that. But as for Manassas Park, it's mostly outreach, education.
And if there was a pool that had tap full, dirty and murky water, can you force the residents to have it emptied?
One thing we normally do is we try to work with education first. We have a notice that we actually will go out first and see if they're home. We give them a notice. We give them so many days to use the term correct that they can either drain the pool or they can treat the pool. I have a service. But when it comes down to anything enforcement, that's when we tackle along with our code enforcement. It could become a health and safety menace, but so far we have not gone down that path. Most residents have been very compliant once we explain the education part of the West Nile virus, not only for them, but also for the neighbors. So far haven't got to the enforcement part.
Thank you.
Laszlo, did you have a comment?
Yeah, I just want to add from a city staff perspective, our Parks and Rec and Community Development Department do have contact private sector kind of pest control that will do treatment for mosquitoes and ticks in kind of our standing water areas in our parks and our stormwater areas.
Is that done consistently every year? It used to be done years ago
It wasn't
consistently.
consistent, but
Yeah.
that is something we're looking into now.
Okay, thank you. Thank you. Do you have a follow-up, Councilmember Moore?
No, I'm fine. Thank you very much.
Okay, thank you. Councilmember Javed?
I have no questions. Thank you for the presentation. This is very informative, but I have no comments at this time.
Thank you. Vice Mayor Banks?
Thank you, Dr. Baker and the staff of the Prince William Health District for this presentation. I have a question about going back to the COVID-19 vaccinations. A lot of my citizens are asking me about how, if you can give me an estimate or just, if you can, how long will this shortage of vaccines last?
I really can't give you an estimate. I can tell you that the state of Virginia only gets 105,000 for 35 health districts right now. We've been told that that will be probably true for the next couple of weeks. You have heard that President Biden has promised to increase the amount, but production is the issue. And you can't, it takes several months for production to, increase. It's not something that happens overnight. And so even though the United States might buy more vaccines, it doesn't end up in our community for several months because it requires production. Johnson & Johnson, the one-dose vaccine, we're hoping will go through, it's completed phase 3 very soon and perhaps will be available next month. There is advantages and disadvantages just to that vaccine as there is to any of the vaccines we have presently. But the more choices we have, obviously, the more people can be vaccinated.
Thank you.
Okay.
And so I'm thinking, all this is going to impact the transition to other phases, right? It's going to slow that advancement to other phases, so other people have to wait who aren't eligible for the phase 1A and phase 1B.
Unfortunately, that's true. There is a 1C, which are also essential workers, but maybe not have as much direct contact with the public. And finally, then it's everybody. The issue is what we have to remember at this point, the vaccine is just a tool. In addition, we're going to have to continue to wear our face masks. We're going to have to continue to social distance. We're going to have to continue to wash our hands. We're going to have to continue to prevent, to avoid large social gatherings. Number one, you don't become immune immediately. It takes several weeks, even after the second dose. Number two, we honestly don't know how long that protection lasts. Is this going to be a vaccine like the flu vaccine, where we need to be vaccinated every year? All that's still not known and is being studied.
And my final question is, once we're able to get to that phase where the mass of the population can be vaccinated, how do you foresee the deployment of the vaccine? I mean, is it going to be like how it is now, or will it be through the hospitals or pharmacies?
Just to let you know, we are already in the district, including pharmacies, in supporting our effort. We have one Safeway's pharmacy. The challenge with getting vaccinated in a pharmacy itself is they really don't have a whole lot of room. And so unlike other vaccines, not only do we have to social distance people, they also have to, with Pfizer and Moderna, have to be watched for 15 minutes after, sometimes 30 minutes after. We really need a whole lot of space. So a pharmacy is a great place because they're in communities, but can't do a whole lot of people in a day. We've worked with Safeway Pharmacy on the east end of the county to provide vaccines 3 times a week in a clinic type situation where they can vaccinate many more people. We also have worked with a pharmacy on the west end that is in a community of a lot of older adults. And so it's convenient for that population. I do believe that, and it's already started, President Biden has already decided that he's going to include pharmacies in the vaccine distribution. Again, they're great because they're in the communities. The challenge is in a pharmacy itself, it's difficult for CVS or whatever to do more than maybe 20 or 30 a day if we're lucky. Now, the pharmacy hours being extended and some of them 24 hours may be very convenient or much more convenient for people who don't have regular hours. We've also provided vaccines to Kaiser because Kaiser has a huge footprint in our community and has agreed just to use our vaccine for our community. We've also certain providers that actually, healthcare providers that care for the elderly, have a large elderly population. We've provided vaccines. So it's not just the health district or the community health center that's vaccinating our community. We're trying to distribute what little we have so people have various opportunities to get vaccinated.
Thank you.
Okay. Thank you, Preston. I have a question about West Nile virus. Some years ago, West Nile was found in a dipping station in southern Prince William County. I haven't heard of that being discovered lately since then. Is this something that is reported to the public? How do they handle that? And have we had a case since then?
No, this is Patrick. That's a great question. Over the past couple of years, the number of positive West Nile foods have declined in Prince William County. They are doing a study, look at the trends, but that was a hot spot. But over the past few years, they do still sample those areas, looking for positive cases. But over the past couple of years, the numbers have been so low. So normally when we get a positive food case, we will actually we used to do a press release when it's a large number, but now because those numbers are so low, we work with the county. They may send a notice out or something of that nature. So as for the past couple, 2 or 3 years, now they don't know why, but the trend has went down and we have less positive cases of West Nile.
Okay, thank you. Interesting.
You're welcome.
Yeah.
Yes.
If there's
I think
no...
it might have something to do with the weather, the trends, but they have history from going back the past 10 years, and each year the numbers decline and decline. And they do a lot of treatment, a lot of siding over the years. They think that might play a big part in it, in the major spots throughout the county, just treat those before any kind of rainstorm. So I think a lot of siding and different things like that can definitely help, but it has been a very big decline in the past 2 or 3 years.
Okay, thank you very much. Dr. Ansher, thank you so much. You and your team gave a wonderful presentation this evening. We really appreciate everything you folks do for the community.
Okay, and we enjoy working with Steve. He's been a great addition to your team, too.
Yes, we agree. Thank you.
You're welcome.
Okay, moving on to number 5. This is a resolution recognizing Mr. Steve Frick. Whereas the City of Manassas Park Community Emergency Response Team, CERT, is a group of specially trained citizens that can be activated and deployed to assist the city's public safety agencies during a disaster or planned event, and educates citizens about disaster preparedness for hazards that may affect their area, and trains them in basic disaster response skills such as fire safety, light search and rescue, team organization, and disaster medical operations. CERT members are encouraged to support emergency response agencies by taking an active role in emergency preparedness projects in their community and functions under the direction of the City of Manassas Park Emergency Management Department. And whereas Steve Frick joined the Manassas Park CERT in 2001 as a founding member and immediately volunteered for the team coordinator position, a position he held for 10 years. In 2011, he stepped down from the team coordinator position, but continued to support the team as a regular member. And whereas Steve supported many events in the Manassas Park area, including cleanup after Snowmageddon, numerous parades, informing the local populace during public events, helping with crowd management at fireworks and COVID testing. He was an avid amateur ham radio operator, a member of the Prince William County Amateur Radio Emergency Services, ARES cadre, and an emergency coordinator for the cadre from 2000 to 2005. Now, therefore, be it resolved that the Manassas Park governing body, meeting in regular session on February 2nd, 2021, does recognize Steve Frick, a longtime resident of Manassas Park, for his volunteer work with CERT and his support for many other public events. He will be missed. Do we have a motion to approve?
So moved.
Second.
All in favor?
Aye.
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 Okay.
Can you
Opposed?
turn on the camera for the governing body meeting room?
What was the question?
Go camera.
Okay.
You can't see the video.
Okay. Okay.
Thank you.
Okay. No abstentions. Motion passes unanimously. Excuse me. Mr. Frick is not here this evening, but Laszlo, would you give him our sincere appreciation?
Mayor, actually, we have Greg Gresham. He is the CERT team leader, and he's going to share a few words. With Steve.
Excellent.
Steve, and before I get transition to him, we're really fortunate to have Steve and his wife volunteer with CERT. It's a great organization that supported the city for many years, and they've done an incredible job throughout the pandemic, from testing to vaccination to the food hotline. So we're really appreciative of the work that CERT does, especially Steve and his wife.
Was he able to, were they able to join us electronically this evening?
Yes, he's on right now.
Okay, super.
The floor is yours.
Welcome, Mr. Frick.
Mr. Gresham, Mr. Gresham, the CERT team leader.
Oh, Mr. Gresham.
Yes, ma'am, I'm here. Thank you for allowing me to speak today. Last month, we lost a good friend, a founding team member and citizen of Manassas Park, Steve. He passed away on January 2nd due to complications from COVID-19. As you heard, he was a founding member and first team leader of our community emergency response team. After 9/11 happened, there was a need to involve everyday citizens in helping during the immediate time after a disaster. And Steve was one of the first people in the area to volunteer and help set up our Manassas Park team. When a leader was needed to help guide the team during its early years, Steve stepped up again and volunteered to lead the team. During his tenure, he helped to support the city during large planned events, local emergencies, and like local emergencies, the Snowmageddon event in 2010. As you also heard, Steve was an avid amateur radio operator. He was a member and former officer of the local Old Virginia Hams Radio Club for many, many years. And he would often help new hams such as myself with his insight and experience. He was also a coordinator for our local Aries cadre, the amateur radio emergency services cadre for Prince William County, where he volunteered his time and radio equipment to help out with communications after local emergencies, during large public events and emergency exercises. Steve was a loving husband of 25 years to his wife, Jan, father to his son, Rob, and friend to too many people to name. He also had a very sharp laugh that would get others to join in with him. Steve will be missed by everyone that knew him, and will be missed a lot by everybody. Thank you again for this opportunity to speak to you.
Thank you so much, and our condolences. I was not aware that the gentleman had passed away. The way that the resolution is written could be interpreted as he moved to another locality. So please accept our sincere condolences. And thank you for your kind words. Okay, no presentations. Moving on to consent agenda. Consent agenda consists of the approval of the minutes of January 12th and approval of the corrected minutes of January 19th, 2021. Do we have a motion?
So moved. Second.
All in favor?
Aye.
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 Okay. Opposed, abstained, motion carries. Thank you. Okay. Moving on to unfinished business, we have approval of rezoning and waivers, the public hearing having already occurred on January 19th.
Yes, so this is Nikki. I'm coming to you remotely tonight.
Welcome, Nikki.
Just to recap, this is thank you. This is a rezoning for 9202 Manassas Drive. It's rezoning from the I-1 Industrial District to the MUD Downtown Mixed Use District, along with 4 zoning waivers and 1 public facilities manual waiver. As the mayor mentioned, the public hearing was held on January 19th, with the Planning Commission holding its public hearing on the 13th of January, where they recommended approval of the rezoning along with the 4 zoning waivers and 1 public facility waiver. Staff is recommending approval of the rezoning and the mentioned waivers. I'd be happy to answer any questions.
I'd like to move the rezoning and the waivers.
Just a minute, Councilmember Moore, just a moment. We're going to go around and see if there's any questions. Councilmember.
Motion on the floor.
Excuse me?
Go ahead. Okay, I understand. That's fine.
Okay. Councilmember Hampton.
No, I asked all my questions on the 19th.
Okay, super. Councilmember Mensing.
No remaining questions.
Councilmember Amaya.
No questions.
Okay. Councilmember Javed.
No questions. Thank you.
Okay. Councilmember Moore.
Question.
Okay. Vice Mayor Banks.
No questions. Thanks.
Okay. With no questions, the staff recommendation is that the governing body approve rezoning RZ number 20-11. Staff further recommends that the governing body approve zoning waivers WAI number 20-011D, WAI number 20-011E, WAI number 20-011I, WAI number 20-011J, and Public Facilities Manual Waiver PFW number 20-11F. Do we have a motion?
So moved. Okay. Second.
Okay, all in favor?
Aye.
Aye.
Opposed? Abstained? Okay, motion carries. Thank you.
One abstention from.
Oh, one abstention from Councilmember Javed. Thank you. Okay, moving on to new business. We have amendment to the FY 1920 performance contract with the Community Services Board. And I believe we have the executive director with us this evening, Ms. Lisa Madron. Welcome, Ms. Madron.
Thank you very much.
Am I pronouncing your name correctly?
Members, I'm, as was said, the executive director of community services, and I thank you for the opportunity to speak with you tonight about community services and our performance contract. And with some help from Keith, I'd be glad to go through the PowerPoint if you'd like.
Yes, you want us to share your screen so you can share with us?
I don't have it. I had asked, is it
Okay,
shown?
it was an older presentation. That's why we didn't upload it. I just put it there as a reference.
I can talk through it.
Okay.
I'm happy to do that.
Okay, if not, we can quickly bring it up. It's up to you.
I'm happy to go ahead and just talk. And
Okay, that's fine.
See it.
That's fine, thank you.
The community services is the single point of entry into the publicly funded mental health, substance abuse, and developmental disability services. And we provide treatment and services to increase the well-being of those that we serve. We have over 13 programs that focus on youth and adults with serious mental illness, substance use disorders, and developmental disabilities. Prior to July 2019, we were mandated by the state, the Department of Behavioral Health and Developmental Services, to provide emergency services screening for psychiatric hospitalizations and for case management services. And then the General Assembly added 9 more core services through STEP Virginia, which is a model to align services among CSBs in Virginia. No CSB provides the exact same services, and there was a desire by the General Assembly to ensure that happened. And we are one of 40 CSBs in Virginia that are required by code to be operational for public behavioral health and developmental disabilities. CSB is organized with as an administrative policy board. We have 10 members that are part of our board, and 1 member from Manassas Park, Latasha Simmons, who we are very thankful for, as she is participates greatly and contributes to our board and our CS staff. We are here tonight to ask for a continuance of the performance contract. The state performance contract comes out and identifies the responsibilities for CSBs and the funding that the state will give us to provide the treatment and services that they are funding. and outlines their responsibilities. And typically this contract is a 2-year contract. That's why you'll see it as 2019 and 2020. But with the changes that the state's been going through, it's been renewed every year. And so I have come to you typically in September to ask for the renewal of the contract. This year with COVID, the state extended the contract from July through the end of December, keeping the same services, the same responsibilities, and funding us at the same level. And they were anticipating coming out with the new contract in December for January through June, but that didn't happen. So they're basically extending the 2019-2020 contract till the end of June. Again, we'll be providing the same services. There is anticipation that there will be many more changes into what they will be expecting us to do come July, but we don't know what that is. Sometimes we get it between the new contract to review between June and August, and we have to get it back signed to the department by September. Typically, the department covers about 50% of our budget. We have exhibits that come with the contract that really outline and specify our services, and we project how many services we may be providing, how many outpatient services per year, or how many residential, or and how much we're anticipating to spend on those services. And then annually, we provide them a listing of how many services we have provided, and they do an analysis. And this is very helpful on a number of occasions because it allows us to see what our need is or what people are asking for, but it also feeds the federal government for further funding. And to give you an example, we offer medication-assisted treatment, which is individuals that have a substance use disorder, particularly an opiate use disorder, can be prescribed Suboxone to help them combat the opiate addiction that they have. And we offer services to do that. And the federal government tracks the treatment that we provide and the services that those individuals get, because many providers in the community that offer medication-assisted treatment may not do it with the treatment, which is so they'll just be getting the medication. And the two together is an evidence-based treatment, and it's found to have individuals be more successful in breaking their addiction. The approval process for the contract is we bring it to the Board of County Supervisors and to the cities of Manassas Park and Manassas City to review and then to hopefully approve, and we sign it and give it back to the state, and the state then continues to send us warrant payments. We, as I mentioned, provide services anywhere from our early intervention programs, which are our infant and toddler programs for birth to 3 for infants that have a delay, through some of our most significant intensive programs, our program for assertive community treatment, which is a team approach program in the community. With COVID, we have continued to operate in person, and we've also moved some services to telehealth. One of the services that we added through Step Virginia, which was same-day access, because we could not have people walking in, because some days we would get 45 people in our main locations at either Woodbridge and our Ferlazzo Center or Manassas and our Sudley North Center. We had to close the doors but make appointments for people virtually or walk-in appointments. And we've been doing that throughout the start of COVID. Our groups have really skyrocketed. We have been able to provide telehealth treatment groups for our substance use population, for our in-school populations. That's been a challenge we are in the high schools, but because the schools have been closed, we've not had our therapists in the high schools, so they've been offering groups and keeping in contact with a lot of the youth that way. We also offer a first episode psychosis program and in a team approach for individuals, young adults who may be experiencing their first episode psychosis. So we have a variety of treatments, and we continue to serve in person and through telehealth. Any questions?
Thank you very much. Am I pronouncing your name correctly? Is it Madron or Madron?
Madron.
Madra. Thank you. Let's start with our folks at home. Councilmember Moore, do you have any questions?
No question. Thank you for the presentation.
Councilmember Javed.
Yeah, I just have a question regarding, I guess, the city's contribution. Would that increase, or is that going to be the same as what we've been doing previously?
So the county and the city has a formula for the contribution, and they tell us what that is. And just to let you know, for 2020, the contribution was $932,436, and the services that we rendered was at a level of $1,141,973. And for fiscal year 21, I'm told that the contribution from the city is around $804,332. And again, the county finance process sets the rates to that.
Do you have a follow-up?
And then, yeah, I got one last question. Has our, I guess, participation from our residents increased as well, or what's that number look like from FY19?
For actually FY20, the total unique residents served were around 479, but there was an increase to the services. So even though the contribution was a certain rate, there has been an increase to the services provided. And one of the things that we found in COVID across the board is, although the service hours did not, the number of people coming in, or the new people coming in, did not increase, partially because of COVID. Our contacts and our connections with individuals did increase. In other words, we were seeing people much more frequently than had we been providing services in person. The contact may not have been as long, but they were more frequent.
Mm-hmm. Okay. Thank you. The number
that's for me. Thank you.
Okay, thank you. The number you quoted, is that unique users, unique individuals?
Yes, the 479.
And do you foresee that increasing?
I would anticipate it increasing just because our services are increasing, and we're definitely trying to offer more, but we don't know for sure. We'll continue to report that. I definitely believe that the services that we're providing, the cost of those services will be valued. The value of that will increase.
Mm-hmm. I was thinking in terms of COVID causing a greater need.
Well, that's been one area that we're seeing across the board for mental health and anxiety. And the challenge there is because we have waiting lists and we're the public behavioral health system, we have prioritized those with serious mental illness, those with substance use disorders. And oftentimes the individuals that have mental health, depression, anxiety, where COVID has become a factor, we refer to other community providers because we don't have the capacity to serve everyone. So we try to connect individuals with providers. We work with some providers to specifically be able to take them. And I know that there has been an increase in some of the providers providing telehealth services. So we do anticipate, we're already seeing our waiting lists growing.
Okay. Thank you. Thank you. Vice Mayor Banks.
Thank you for the presentation. Besides COVID, what's the other leading cause of the reasons people are seeking your services for mental health?
Well, again, with our focus on serious mental illness, we're dealing with mostly individuals that have schizophrenia, bipolar disorder, major depression. And this is chronic conditions and that are often lifelong or cyclical. For the substance abuse, it's definitely, we have seen a trend with COVID and with the lack of social connections for people, really causing more isolation and that increasing.
Thank you.
Okay.
That's all.
Okay. Councilmember Hampton.
No questions.
Okay. Councilmember Mensing.
No questions. Thank you.
Councilmember Amaya.
No questions, thank you.
Okay, thank you. Okay, thank you so much, Ms. Madron. That was very good information. We very much appreciate everything that you do and that the CSB does. The staff recommendation is that the governing body adopt the attached resolution approving the amendment number 2 to the fiscal year 2019 and fiscal year 2020 community services performance contract renewal. Do we have a motion?
So moved.
Second.
All in favor?
Aye.
Aye. Aye.
Okay. Opposed? Abstained? Motion carries. Thank you again very much.
Thank you all.
Okay. Next, we have resolution authorizing Economic Development Authority to issue lease revenue bonds.
Good evening, Mayor and members of the governing body. I do want to note a quick change from the agenda item that was posted over this weekend, so the numbers were a little bit off. So on the agenda page, it said FY 24 through 25 would be $826,000 per year in total capital lease payments from the city to the trustee to pay off the EDA lease revenue bonds. The updated financial table was posted on Saturday evening and shared. Page 14 of that actually lists the annual capital lease schedule. You can see in FY 24, the payment from the city is $420,000. Then it goes up to the $840,000 and then up to $1.47 million. And by doing that, you see that the later years it goes up to $1.499. The reason why we're pushing back the payments as far as possible, if you remember, and for the new governing body members, we were evaluating the utilization of a program called tax increment financing, where the revenues that come in, that's directly paying the payments per year. When we explored that, it's difficult to do in Virginia. Arlington did one, it didn't go that well for them, and it would cost an additional, we forecast about $13.5 million just to pursue that route. But we wanted to make sure that the development itself was generating more than sufficient revenue each year to pay for the annual city hall payments. That's what this does. It makes sure it buys us a 2-3 year cushion beyond what we're expecting in terms of development to make sure that we have more than enough, not even have to tap into those proffers that I'm going to discuss later this evening in the manager session of this meeting, to make sure that we have enough of the new tax base to pay for these new payments and still, again, in those early years generate over the 30 years, the profit numbers, but we want to make sure that even in the first few years of the payments, there was going to be a profit for our current taxpayers to help fund our initiative. So that was kind of the reasoning behind it. Usually you're not starting to make payments until the product is delivered. The city hall should be done per current forecast summer of 2022, but the rest of the associated infrastructure, they're looking more like sometime in 2023. So we would probably normally start paying around that 23, but again, we wanted to push this back as far as possible to make sure that we had that cushion without trying to pursue a TIF that, again, because of Arlington's experience, it wasn't going to be that easy for us to secure, and what likely was going to require a large reserve fund that we would have to put up that we wouldn't have the money to do so. And again, would take down a significant amount of profits. But this kind of accomplishes those goals while maximizing our profits over 30 years. You see, I also shared with you this weekend all of the EDA documentation that we're going to go over tomorrow. So the EDA has a much larger role in this. than the city does in terms of the bond documentations. You'll see they have the preliminary official statement, the Appendix A, all the different documents that are involved with the bond. What you're being asked tonight is kind of twofold. It's really to authorize the EDA to take that action, to review the documents, and for them, even though, again, they're a subdivision of the state, they're the city, they've been created by the governing body to issue this kind of state vehicle for funding. So they need your authorization to do so. And because you see that the way that the bonds are being paid is through this annual capital lease payment structure that we're setting up through the lease documents, which I did share directly to you and post on the governing body site. So the resolution tonight is authorizing the EDA to go ahead and go ahead and issue those lease revenue bonds. They'll be reviewing those documents tomorrow, and then also to essentially allow staff, city attorney, all to continue to review those lease documents themselves. They're in substantial form right now, but again, as the city attorney noted, they still have a lot more review to go through. All the documents do, but we're seeking authorization tonight to kind of take that next step here in the downtown development of getting the lease revenue bonds issued so that the developer can go ahead and implement phase 1A of the overall development.
Thank you, Laszlo. Councilmember Hampton?
Yep. I have a quick question to make sure I understand.
Yeah.
We are pushing the payments back to fiscal 24 so that we can get the buildings built and we can start generating that revenue and have a little bit more, so we're not cutting let me figure out a better way to say it, that we've got a little bit of a cushion so that we're not putting ourselves in jeopardy.
Yeah, it's not so much jeopardy. Like, we're going to have easily the tax base to make those payments. In FY23, our debt position is dropping pretty dramatically. Our tax base each year is improving regardless. So, but our promise to residents when we were doing the town halls, when we were doing all the public engagements, was like, look, we have these unfunded capital liabilities, the city hall and the public works, that we need to address. We don't currently have the tax base to address them. We're pursuing this development, and one of the major reasons is to address these unfunded capital liabilities without impacting your wallets, right? So the goal was that the development itself would generate the proceeds at a huge profit, but even in the first few years would generate the proceeds to pay for these unfunded capital liabilities, to ease that pressure on residents so we can continue to fund the priorities that they have for us as well. So that was kind of a promise we had to residents. This mechanism gives us that better cushion to show them that we are staying true to our word, that we wanted the new revenues from the new development to pay for that and not current taxpayers.
Okay, and that explains why in the one document it said that we were going to start paying at the end of this year, but now that's why we're pushing it out to about 3 years.
There's two things. So like you'll see in the documents are going to list 21 for the holders of the bond, but there's a capital interest fund, a capitalized interest fund. That's actually making those payments from FY21 through FY24.
Okay.
And then the city starts paying that in FY24.
Okay.
If that makes sense. So
yeah.
in a lot of the documents, it's going to show 21 because that's where the people who are buying the bonds, when they're going to start receiving kind of a return on their investment. But the money from that is coming through a separate capitalized interest fund, which then the city starts paying off in FY24.
Okay, thank you.
And I know that gets confusing.
Well, yeah.
21 and 24 showing.
Right, and I figure if, with all my education, if I'm getting confused and I have to ask a question, so is everybody else.
Believe me, this is confusing for all of us. That's what we
and
have.
I used to sit in conferences on tax credit, so.
That's what we have our financial advisors and our bond counsel.
We have people far smarter than I.
Yeah, this is what they do. I mean, this is its own unique science, if you will, kind of the whole bond process. So Dean and I have been we've been asking a ton of questions as well. The EDA will be asking a ton of questions. So there's still a lot more work to do, but they're here, they're representing the cities. They're not representing the developer. The developer's part of this. They're helping us with the budget. They brought out Northwest Capital.
They're an extension of us.
They're an extension of us to represent our interests, to make sure that our interests are being met with this process.
Okay, thank you.
Yeah, absolutely.
Okay, Councilmember Mensing?
Just a quick question. When are we expecting the residential, like the first part of the residential, to be complete?
And let me follow up to give you the accurate number, but I know that the takedown schedule is, I want to say October of 2021 is when the first sites will be pad ready to hand over to Stanley Martin. Stanley Martin said within 90 to 120 days they'll have the first unit sold.
Wow.
After that. So you're talking about early 2022, because a lot of the infrastructure will already be in place. They're already going to be mobilized. They're going to build out quickly, which again was one of the reasons, we shifted from toll to Stanley, was to make sure, again, keep a promise to our residents. The development's going to be here. Stanley Martin's very eager to do this. They've kind of completed other developments in the region, so this is going to be their next big project. So they're going to be building out quickly, pretty much through years 22 through 24, so that we have more than enough revenue. Again, not even considering phase 4 or phase 2, which will be happening at the same time as well. Even just from phase 3, we're going to have more than enough revenue to pay off this thing, and then we start amassing the massive amount of surpluses, and hopefully be able to keep all the profit cash for other initiatives that I'm going to talk about later tonight as well.
Okay, thank you.
Okay. Councilmember Amaya?
Yes, so the purpose of us authorizing this resolution is just for you to go ahead and have EDA just release out or do the bonds. Is that all we're doing?
Yeah, so the EDA still has to, remember, they're a separate legal entity, so they can still say no, technically, as a board, but you're authorizing them to go ahead and take this action.
Okay.
So for them to consider taking this action. Now they're going to meet tomorrow night,
Okay.
and they're an independent body that they'll evaluate a lot more documents as well. We'll have our financial advisors, our bond counsel there. I'm also the staffer for the EDA, so we're going to talk through the EDA through this process. At the last meeting, I spent a good 2-3 hours with them going over the kind of the history of the development, why we were doing this, our unfunded capital liabilities, the goal for tax base improvement, what this process was, and I encourage you to, if you can watch that YouTube video, the financial advisors, the bond counsel, it was kind of second night of explaining this. I think they did a really good job explaining the EDA, the entire process, and now again tomorrow night we'll discuss this step, but they need the authorization from the governing body before they can take the action of going ahead and issuing, because the underlying revenue to pay for that bond is going to come from this development from the city, with you all taking the affirmative each year to appropriate that money for that.
Okay. Thank you.
Do you have a follow-up?
No.
Okay. Councilmember Moore, questions?
No real question, but Laszlo, can you tell me when the EDA will be meeting tomorrow? Is that an open meeting, and what time will it take place?
It is an open meeting. It's at 7 p.m. and we're usually live streaming on YouTube. So if you go to the city of Manassas Park. What's that?
Do you want to attend in person?
Yeah, you can attend in person as well. Yep. Last time, I think all members were virtual, but we still did have cameras rolling, and tomorrow night we'll do the same thing. I'll be here as well, and so will our branding consultant, who will be joining you all later tonight.
Okay, so you'll mail out the Zoom link or the GoToMeetings link?
Well, no, you can watch it on YouTube. So the members on the GoToMeeting will be the EDA members, and then actually our branding consultant, our financial advisors, our bond counsel, they'll all be joining the EDA remotely. But then the public is welcome to come in person or watch on YouTube as well. Yeah.
Fantastic, thank you.
But all members will probably be virtual. Is that what you're saying?
I think one may be in person, but last time all members were virtual.
Okay.
Yeah, but this time I'll be here. I ended up doing it in my office last time, but it was still live streaming on YouTube, and we still had the cameras rolling here. And
Okay.
Land over here if anyone wanted to join us.
Okay, thank you. Councilmember Javed.
My only question is that has the budget and everything been finalized, or do you anticipate any change in any of the dollar amounts in the near future?
Yeah, so we're finalizing the budget by the first week of March. That's what North Scott's working on right now. The numbers will likely shift around, but you can see from the resolution that there's a giant cushion for that purpose. Hopefully the numbers will go down versus up, so they're actually going to have bids on hand by that time. So they're going to have a better idea from the actual contractors what this will cost at that point. Of course, they've been working with contracting firms and others right now to kind of shore up those numbers, and we've been back and forth from the owner, right, the design team, just constantly making sure we're getting the best product out of this. So those numbers are still in fluctuation, but the resolution builds a pretty good cushion to make sure that we can get this done.
Yeah, I mean, that was my next question, I guess, follow up to that one. I mean, if you have that cushion, I guess it's advisable to go ahead and approve this tonight, or why not wait until they finalize the budget and then reconvene?
Yeah, so the Northwest Capital will be marketing the bonds, I believe, the first week of March. So we actually do need, you don't have to make a decision tonight. You can defer to this meeting on the 16th, but then we would have to have a special meeting with the EDA as well to go ahead and get them to authorize. But you don't have to make a decision tonight, but by February 16th, we would need a decision from the governing body so that the underwriters can go out and actually start marketing the bonds in early March.
We would not want to make the EDA have a special meeting.
Right.
In other words, is what we're saying.
Right.
Okay. Gotcha. Okay. Do you have a follow-up, Haseeb?
No follow-ups.
Okay, thank you. Vice Mayor Banks?
Hi, Boswell. I was looking at the resolution. My first question is, you have for the lease revenue bond amount not to exceed 35 million. Does that include construction inflation?
Yeah, so that's going to be for the project budget, right? So it does account for, hey, we have a number as of, a few weeks ago from Norton Scott. It's supposed to account for any increases in that number over the next month as we finalize the design and they actually get bids back from contractors. It's supposed to cover that amount, plus the capitalized interest fund, which I showed in the memo what that looks like, and then all the fees associated with getting the issue. That's what the $35 million is supposed to cover. Once the bonds are issued and Norton Scott has the contract in place, the only increase in funding that will come after that is that the city initiates a change order in the contract because we need something, or we want something in addition. And so at that point, we would have to take that on. But the goal is by early March, we have a final number, we know what it's going to be, and we know what actual amount needs to be issued.
Okay. What if, just hypothetically, if we need more money than 35 million? What is our...
Yeah. I don't see that happening, but I guess as a worst case, we'd have to come back, we'd have to delay the issuance process or add on an additional issuance after the 35 million. That would be an option. I don't know, Jimmy or TW, if you all have, I guess, what the mechanism will be for that.
Hey, this is Jimmy Sanderson. Good evening. I'll jump in, and TW, you can follow up. The plan is to not sell the bonds until that final budget comes in. It'll be, I think, early March, I believe. So the expectation would be that we would know exactly what the project's going to cost. We're not going to borrow any more than we need to fund that liability. But if for some reason, months from now during construction, there was something that the city wanted to do that would increase the cost of the project, there is a mechanism that we can add to the bonds. It would require another bond issue, or it would require whether that's a public sale from the EDA and an amendment to the lease structure. Whether that was done as a public transaction or through a bank loan, if there was the need for some additional monies to come into play, that would be what you would do. TW, did that make sense?
Yeah, no, I think that's right too.
Mm-hmm. Okay.
So I know this is a conservative amount, and I think this is our estimate here, the 35 million max, but would it change anything in terms of our payment schedule and payment amount if we increase the not to exceed amount of our lease revenue bond?
Only if the actual amount issued would be that amount. So all the resolution is doing, and Jimmy and TW, you can correct me if I'm wrong, it's just authorizing when the underwriters go out and issue the bonds, they're not going to issue more than $35 million. If we don't need the $35 million, they're not going to issue the full amount, if that makes sense.
Mm-hmm.
Thank you.
So it won't affect our annual payments. What will impact our final payments is what the final project budget comes in, and therefore what the last number, somewhere between right now, we're thinking 30 or 35 million, what that will be.
My final question is looking at our payment. So we don't begin payments until 2024, which is the 826,000 each year. And then it jumps up in 2026. Almost double to 1.47 million each year. Now, is there any way we can kind of have a gradual scale instead of that jumping up from FY25 to FY26?
Yeah, so for correction, so in FY24, it's roughly 400,000 to 450,000. Then the next year it goes up to, so it almost doubles each year. So next year it'll go up to over 800,000, and then again it will go up to that 1.49 million. So I guess you could, but again, every time you delay, you're adding to that capitalized interest fund, and you're making the total amounts paid, even greater. But again, we're going to have more than enough money by that FY26 to pay for that amount. So it's kind of a balance. Do we want to pay more over the 30 years because we keep pushing it back further, and therefore we're losing kind of on those profits? But I think that would be an option if that's something you all want to do. And Jimmy, TW, correct me if I'm wrong, if we can't do that.
This is Jimmy. No, you certainly can. I mean, what you see on the capital lease payment side, that first year in 24, that's 6 months worth of interest in that year. So it's a half a year's interest that falls into that fiscal year. 25 is a full year, 12 months of interest on the capital lease. And then what we would do typically is we're basically doing level debt service. So you try to structure it so your debt service is level each year going forward. So I think what you're suggesting is, would you want to move some of the principal out of that FY26 year and move it back? And Laszlo's correct. You can move some of that principal back. We can't capitalize interest, I don't think, out to 2026. I'll let TW address that. But you could certainly move some of the principal. As you move principal and delay the repayment of it, obviously you're going to be pushing it back further. It'll be at a higher interest rate on the longer part of the lease, and then again you're paying interest a little bit longer on those portions of the capital lease. So you do have the ability to structure it a little bit more, but Laszlo is right. The more you do that, the more it's going to cost and interest costs, especially if you're comfortable that you've given yourself enough time to get the project completed, have the economic development projects done, and that additional revenue coming into the city.
Okay. Do we have to make that decision now, or can we have the flexibility to make that decision, let's say in FY 2025?
No, that decision will need to be made at the time that we sell the bond. So if council's sort of direction, what you're doing right now is you're delegating to your staff to go out and sell the bonds through the EDA with this parameters that are laid out in this resolution. So these are the parameters that the bonds will be structured, and therefore the capital lease will be structured to satisfy it. So I think if you wanted to provide some guidance to Laszlo as a body, how you might want to have the debt structured, that's something that we're going to want to talk about and get sort of ironed out before we go into the market and start to market the bonds and ultimately have the EDA sell them. Because again, they'll be locked in at that point, and then the capital lease payments will be locked in at that point as well.
Yeah, this is a big decision for us. I mean, 2026 is 4 years from now. That's pretty fast. And we have to try to, I guess, assume or predict the development, that it'll be complete in, I guess, near full, full capacity. Because that's a large payment right there, that 1.4.
Yeah, so it doesn't have to be completely done. So you can see just the residential piece of phase 3 by FY26. If it's complete, will generate about $1.9 million. So again, you don't need it to be fully complete, and that's just the residential piece. That doesn't factor in the commercial building, real estate value, and again, it doesn't factor in both phase 2 and 4, which are happening concurrently.
And we did go with the more aggressive builder.
Yes.
Yeah.
Oh, yeah,
Okay.
absolutely. Going
Yeah.
with the very
Okay.
aggressive builder who,
Yeah.
again, they keep developing in the city of Manassas and selling during COVID. The real estate market's very hot right now. So there's, again, you don't have to get to full completion to have enough money to pay for this. And again, that would assume that phase 2 and phase 4 also are just at a standstill and that they're not building apartments when we know how hot apartments are in the market. It's not likely that will happen.
Yeah. So Preston, with that in mind, it does not make sense to increase the amount of interest that we would have to pay.
Yeah. I thanks. I understand. It is a trade-off. Yeah. I just wanted to present it to the governing body so you guys are aware.
Yeah. Thank you.
I think this approach that we laid out here is kind of the balanced approach of pushing it back as far as possible, while still making sure that we're capturing as much revenue as we can. Again, generating those profits in those years. So we continue to generate in FY23, FY24, FY25. We're generating big profits to help us right now with the things that we want to accomplish, but also pushing things back as well. It's balancing kind of both objectives.
Okay. Thank you. Do you have any more follow-up, Preston? Follow-up, or are you done, Preston?
Oh, I'm done. Thank you.
Okay. Thank you. Thank you.
I have a quick question.
Sure.
So as you guys are talking to me, it sounds very much like making a decision on your college loans. If you get the forbearance, I guess that's the exact word they use, and you don't pay because you read some hardship, but meantime, things are just starting to increase.
Correct.
So it's the same concept.
Absolutely.
Okay. Thank you.
Yep.
Okay. Staff recommendation is that the governing body adopt the attached resolution authorizing the Economic Development Authority to issue lease revenue bonds in support of the public component of the public-private partnership with Norton Scott. Do we have a motion?
So move the resolution.
Do we have a second?
Second.
Okay. All in favor?
Aye.
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 Opposed? Abstained? Councilmember Javed, I didn't hear your voice. How did you vote? I think he froze. Yeah, I think you're right. Okay. Okay.
Steve, can you hear us?
Could he put his comment in the chat?
Or text us.
Yeah, or he could text Keith.
Can you hear me?
Now we
Yes,
can hear you,
yes. How did you vote?
Can you?
I'm sorry, how did you vote, Hasib? Okay. Hasib, can you go ahead and text Laszlo or Keith how you voted? Because I didn't hear your voice at all. Cool. He looks like he's still frozen.
Do it in the chat function. Hey, so you're on speaker right now. Can you just confirm how you voted?
Yeah, lost connection. So you guys took the vote?
Yes, they're waiting for your vote. You're on speaker right now, so they can hear you.
Okay. Yeah, no, I guess I was trying to chime in before the vote. I was going to say that, I mean, before we even get a finalized budget, is it wise to issue this bond before even getting a final budget? But I guess if the majority is in favor of it, then that's fine. We can go ahead and move forward.
What is your vote?
So what's your vote, Steve? Are you yes?
Yes, yes.
Okay.
Okay, thank you. For the record, Councilmember Javed voted yes. Okay. Moving on. Branding discussion.
Great. Before we get to that, Jimmy and TW, feel free to log off unless you want to hear about branding.
Thank you, gentlemen, very much.
Thank y'all. Thank you.
Thank y'all. Great. So good evening again, governing body. This is another step in our economic development effort that we talked about years ago when we first held our first retreat, and as I've been briefing you governing bodies of members as they come on board, that development is not just getting the right product in place, but it also involves heavy marketing like we did to get the developers here. The next step is kind of getting businesses here, which is something I'm working on with HGIS, the company that was approved last summer for help with business retention or recruitment. And then now, once we have those businesses in place, so you have the development in place, you have the businesses in place, now you got to help bring the customers, right? To make sure that it's not just sustainable in terms of development, but also maximizing the potential market capture, so that we're maximizing revenues for the city. So a big part of that's going to be kind of the supply or the demand side bringing customers here, aggressively marketing to them, and figuring out what our signage, our logos, what do we want to be as a city, and specifically also for the downtown, what do we want to be as well. So we brought on a consulting firm that specializes in economic development and also branding initiative, signage, and joining us tonight is Mr. Ben Muldrow drove from Delaware today. He's been meeting with myself and other staff members today, and he's going to do so again tomorrow with different community members, and he can explain kind of what the process will be to kind of kick off this branding process, which should be a couple month, 2 to 3 month process to kind of get a product back to you all and engage the community. So I want to turn it over to Ben.
Thank you, Laszlo. Thank you, governing body. Y'all had quite a meeting tonight to go from complex bonding financials to raising raccoon bites in the region. So I'm going to do my best to be brief. But as Laszlo said, my name is Ben Muldrow. I'm one of the partners of Arnett Muldrow and Associates. We're an urban planning firm based down in Greenville, South Carolina. And one of our specialties is community marketing and branding. We've had the privilege of working with over 350 communities in 40 states and 5 countries. And we're particularly interested in the relationship between customers and consumers and residents in a downtown. And the idea of this level of development going on in Manassas Park, we know that you are one of Virginia's youngest cities, but we also know that there's an intense pride here in Manassas Park. And as we go through this branding process, we're looking forward to identifying those qualities and attributes that the citizens of Manassas Park hold dear, building them into a system that we can talk about openly and freely, so that as these new projects come online, as residential recruitment ramps up, the messages that we convey are going to amplify what you love about Manassas Park, not dilute it. So we have just kicked off this process. We are going to be launching a community-wide digital survey so that we can truly hear from the citizens. And I will be hopefully back next month to report the results of that, kind of the things that we hear, the wisdom that we garner from that. And then our overall goal is to be able to present with you within a couple of months a comprehensive communication toolkit that is targeted both at the City of Manassas Park as an organization, but also the creation of a Manassas Park destination brand. And that's a brand that's truly owned by the community. It is a toolkit that is shared by the organizations and the business community, by the event organizers and the community members. It is intended to create brand equity and really that kind of cultivator of pride for the community. So we're going to be creating a tremendous number of tools. We're going to be looking at wayfinding signage. We'll be looking at public space graphics, street banners. But then we'll also be looking at things like recruitment strategies and that messaging strategy that helps to really kind of preserve that unique character. So we are excited to be kicking this project off. We've had a tremendous amount of experience in Northern Virginia, but it is rare to find a community that has such an interesting affinity in itself and kind of a very humble pride in your diversity and just the different factors that make Manassas Park what it is. So we're really, really excited to dig into this project. Again, I want to err on the side of brevity tonight, but I would be more than happy to answer any questions you might have. Just so you do know, as we move through the process, we'll be creating a comprehensive toolbox. It will be made up of a full graphics package. It will have a style guide document. That style guide document will help to define the colors, define the typefaces. Our goal is to preserve the city seal, but to create additional tools on top of that. So this project should not warrant the replacement of any pre-existing investment, but instead be able to give you the tools to help stitch together those additional economic development.
That's good to hear because the city seal is important to a lot of people in the
Absolutely,
city.
absolutely.
That's important.
And just like we've learned from colleges and universities, they have academic logos and then they have athletic logos.
Right.
Your community very much needs that seal, and that seal is this kind of symbol of the formal actions of the government and kind of the longevity of place, where the destination brand is a little bit more nimble. It's a little bit more market related. It has the ability to change with some of the consumer trends where that seal has a much, much longer lifespan. So just want to be very clear, the intention is not at all to replace that, but create additional.
Okay, excellent. This is a great discussion to have. I know what makes us a strong city, I think, is first of all our diversity, and second of all, we do have a strong sense of community, and I think those two combined make us a very welcoming community. I know when I interact with groups and organizations across Northern Virginia, I do not hesitate to say that when you're in Manassas Park, you are home, because it really does feel like home. And I think whatever we do, it has to work on a macro level as well as on a micro level. And the macro level, I think, in terms of attracting businesses and making them feel welcome and that they want to come here and open their business. And of course, on a micro level, that we are welcoming to new residents who move into Manassas Park, making them feel at home.
Absolutely. And I think one of the biggest mistakes that communities often make, especially when they have residential growth on their horizon, is that they focus so much on the sales pitch and don't finish the sale per se.
Right.
We don't want those people to simply come here to put their head in a bed. We want them to become connected and true community members of Manassas Park. So as they make a residential move, we want them to reestablish retail ties. We want them to create new habits, new traditions, and new memories that are tied to this place.
Okay.
So like I say, we're really excited about learning more and being able to present that back. And we will keep you all as a governing body in the loop with the development along the process.
If you're not in a hurry, I'd like to go around and have each governing body member.
If you don't mind, I would love to hear from
we're delighted. I want to hear from absolutely everyone. I just didn't want to detain you if you had other plans.
Not at all.
Okay. Councilmember Hampton.
Hello again.
Hey there.
Hi, my name is Laura Hampton, and as I mentioned, I'm a lifelong resident. The day since I came home from the hospital. Resident on the west side. To kind of give you a little bit about my background, my family's got very deep ties in this community. My father served on the IDA before the EDA existed. He was actually part of the people that was responsible for building that over there. He too, he's now passed, but he and my mother served back when we had a lot of civic communities. The Lions Club and the Signal Hill Lions Club, VFW. My brother just recently retired from the police department. He spent 35 years in public safety, 10 years as a volunteer for Manassas Park Volunteer Fire Department back when we had a volunteer fire department, and then 25 years in law enforcement. I myself served 10 years on the electoral board here in Manassas Park, and then took some time off and then decided to run for city council. So there's a lot of us that are born and raised here that were still around. Back from my generation. So there's a lot of us that have historical pride and also can kind of give you that feel of how it was before we expanded a little bit. So I did have a question though. I mean, I'm accustomed to branding, having spent some time in the marketing communication world. You don't have to do it tonight, but I was wondering if you can point me an example of a destination branding.
Yeah, I think what I can do is I'll send over a couple links, but I think in the simplest kind of mindset, it's just one of those dynamics where you're probably familiar with Main Street organizations. Your neighbor next door has a Main Street organization and a Main Street downtown. Oftentimes, those organizations, they are Manassas Main Street, let's say. They're promoting their downtown.
Okay.
So the difference between, and this is where it is kind of interesting, the city of Manassas Park is an entity, it's an organization, it's a governmental body. The place Manassas Park, that's a place that everybody owns. And if your code enforcer wears that seal and shows they're official, that's not necessarily the same graphic that you can use to represent the place.
Okay.
And the thing that probably is most representative of the pride in place right now would probably actually be graphics that come out of our local high school. And so what we want to do is we wanted to be able to create a toolkit that is focused on, the community of Manassas Park in addition to the city as a whole. So I'll send over a couple examples.
Thank you.
Yeah, just to add to, if you look at Manassas, they kind of have their branding, their insignia with kind of theme. Ben and his team helped me do the same thing in Lovettsville, and we utilize that for all of our marketing as we were pushing out massive amount of events, doing business recruitment. So you kind of have the color schemes, your logo, your I guess your catchphrase as well,
right.
And that becomes part of a consistent messaging. So as Nora and Scott's thinking about, well, what kind of signage are we going to be putting out here? And then phase 4, we want to actually start having a unified strategy across our downtown. That's what's going to be recommended. So it's balancing kind of the community interest, community historical interest, who we are as a community, but also something that works when because we're also trying to sell to people outside of the community to come. So it has to be a balance. But so we've done something like that. I've done something like this in the past, and it did pay off in terms of.
It's kind of like the historic Manassas. There's the Manassas City, Manassasville, and then there's that come to the historic Manassas thing they do the down, and the downtown. Yeah. Okay, thank you.
Okay, Councilmember Mensing.
Yeah, hi. I have a couple questions about the digital survey.
Yes.
Will you be able to do any sort of tracking on this survey to see where the input is coming from, like what section of the city?
In the first, some of the first questions are some of those modifiers, so we'll be able to find out what zip code they're coming from, whether they're in the city limits or not in the city limits. Now, I think that we probably will have to accept the fact that a lot of people don't actually know where they live. So, but yes, we do try to clarify and give you as much information about how many people are doing this, where they're coming from, and kind of what their perspective is. So we'll ask a couple questions on the front end. Do you live in the city of Manassas Park? Do you work in Manassas Park? Do you do both? So it will be able to give us some clarification of what that point of view is.
Okay.
Are you trying to see between west side versus east side?
Yeah, like if we could see like a spread of where the results were coming from.
If we wanted to, what we might be able to do, and let me think through it, we do sometimes ask for, we try not to make the information too invasive because it freaks people out. Like obviously we could ask for their address and then we could drop all those in to drop pin dots on where the responses came from. But when you ask for people's personal addresses, sometimes it freaks them out. In fact, the only information we typically ask for is voluntarily at the end. If they'd like to stay in the loop on the process, they can volunteer their email address. But I'll think about if there's a creative way that we can kind of figure out where they're coming from. Because that would be interesting, especially to see a breakdown of obviously we know there's an east-west divide. Like is there, is there a greater participation from one side versus the other?
Thank you.
How is the survey going to be advertised to people?
So it's going to be, we'll set it up as a Survey Monkey and then we'll see if we can push it out through the city's social media channels.
Okay.
Meeting with the communications committee of the city today to start that process.
Will we be able to also maybe send it to high school students?
Absolutely.
Get it through the schools? Yeah. Okay.
We can probably get that out over our personal networks as well.
Yeah. True. Yeah.
And typically one of the things we get, a lot of times a high school might have an entrepreneurial class, might have a student government class. There are a couple of subjects that are particularly interesting, but my youngest is 7 years old, and she'll take a survey on anything, you know. So being able to get some of that input is always important. Now, as we come back, our second visit will be more of an on-site kind of work session, and there will be some opportunity for us to set up either in-person or virtual additional input sessions that are more digital focus groups. So we try to get a little bit of a gauge off of that public survey of what kind of voices we're hearing from, and then identify some of the voices that we haven't heard from and use that second visit to fill some of those gaps.
Okay, great, thank you.
Thank you.
Councilmember Amaya?
How would the Hispanic or Latino community be addressed?
So obviously, I think one of the things that everything from the input process, making sure that surveys are available in multiple languages, but then also one of the big things, and we already started this conversation with the communication team earlier today, is we need to learn more about how the city currently does communicate in many languages. And, you know, there's a different approach. Different organizations have a different approach. Like, do they create everything as dual language in one format? Do they create two completely different formats utilizing different languages? So we've started talking about that. I can tell you, I think it would be premature for me to say that I think that I have a communication strategy in mind, but obviously we know one of the biggest things that we need to focus in on is making sure that the communication that is intended to communicate is in a format that it can. So we're going to try to craft a strategy that's most appropriate for Manassas Park. We've often found it doesn't matter where you are, there's no kind of turnkey solution, but you have to ask the question, how are people listening? It's not good enough to project the message and say, well, we invited them. You have to make sure that you cultivate that participation. And many of the voices we need to hear from might not be empowered yet to feel like their answers matter. And this is a really great process to engage them.
Okay, thank you.
Okay, thank you. Councilmember Moore?
I have no further questions. Councilmember Amaya addressed my concerns, so I appreciate we're going to reach out to the Latino and Hispanic community in our diverse city, that they'll be able to respond Spanish, so that's good to hear. So thank you for that response.
Thank you, Councilman Moore.
Thank you. Councilmember Javed?
Yes, hey, good evening. This is a great idea, and it's very important to make the community feel included, so that they feel excited about the future of their own city. So that's going to be very interesting to see their input. But as we do the rebranding, I caution that some of the rebranding is not to change our core, but kind of to build off of our already current city's personalities. So that's something I'll be looking at, and I'm sure that we'll have a lot of input in the future. But we have a lot of things to offer, and I'm glad to bring you guys on board. Thanks.
Well, thank you so much, and I can't echo that enough. I describe a community branding process as a preservation process. If you are not focused in on preserving those qualities and attributes that your citizens cherish, then you're creating division with this process, not creating energy and kind of pushing that way forward. So thank you so much for saying it, and we echo that completely.
Vice Mayor Banks?
I just wanted to mention that, I heard that during your presentation that it's the logo or the branding is going to be for the destination. And I just wanted to add that it's not only the destination component, but this is also a logo that belongs to the people.
Yes.
Because as you heard from our council member Hampton, she takes pride in their history of living here, and that's the same as our residents. They like and take pride in this community. So when we create a new logo, it's going to be more than the destination. It's going to be their logo as well.
Absolutely. Absolutely.
Okay. Thank you, Preston. I think you'll get a high turnout on the survey.
Well, and one of the great things that we have seen, as you can imagine, is Survey results, typically, we have seen sometimes as high as, our numbers are increasing 2- and 3-fold.
Okay.
What we would typically see. Just people have become more accustomed to sharing their opinion online. The format has become far more usual to them. So we're seeing socioeconomic splits that are increasing, which is great. Typically, you are not necessarily going to see as many voices from lower socioeconomic levels. We are starting to see that happen. We're hearing really, really inspiring stories about how kids now have Chromebooks at home and their parents are being able to use that to access internet, so their voice is being heard in ways that it wasn't before. So we're excited to get that input and then kind of craft that input strategy from there.
And we're a fairly interactive community, just as we're a community with hospitality. So I think you'll get interaction.
Fantastic.
Okay.
Thank you all so much.
Thank you so much for coming this evening. Very important discussion. Thank you.
And I just wanted to add to that as well, because, as I've engaged with businesses, developers across the region, as you all are aware, a lot of people don't know that we exist or confuse us with Manassas. So it's going to be critical that as the downtown is developed, that's kind of our coming out party, right? We really let people know that we are here, we're a vibrant city. Here's everything that we kind of have to offer to really attract people to our community. So we want to take advantage of that kind of development and just all the positive things that have been happening over the last few years as well. Get the word out for that.
Okay. Moving on to 10A, Manager's Report. First A is Smart Beginnings.
Well, I'm uploading the PowerPoint here. Before I get into this, I did want to thank all of our staff and the MAP Clinic for the good work on Friday. We got 551 people vaccinated. I think that's probably the most that's happened in all the kind of county from the facilities in one day. So it was a great effort from the MAP Clinic with the actual vaccination process, our Parks and Rec staff supporting that infrastructure, our police who really joined me outside to help with all the customer service component, because you're dealing with a lot of people, and it was 9 degrees in the morning, so it was not the funnest experience for everyone, but we figured out a way to kind of get everyone in, our EMS, fire and EMS employees in the waiting area, just to make sure that everyone was fine after we're getting that many people vaccinated. So it was a total team effort led by Keith, coordinated by Keith, to get all these things up and running at kind of last moment's notice. So it was a very successful effort for our city to really start helping get our residents and the residents of the surrounding community to be vaccinated. So it was a great team effort, and I just wanted to thank everyone who was involved in that process and dealing with our customers. So
we appreciate the level of organization that it took to do that. So thank you.
And just one quick thing, even George Mason boasted about it on LinkedIn. They actually took pictures, and I saw it come up on my feed yesterday. And I can tell you from personal experience with the seniors, it's very easy. It's very easy on the seniors. And Laszlo, I actually heard from a few of the citizens that went on Friday, and there was nothing but good things.
Thank you very much. Yeah, I thank them for kind of their patience, because when you're coming to an event like that, you don't know everything that happens in the background. You don't know kind of how much advance notice people have and putting all these things together, but everyone was incredibly patient, which when you have 9-degree weather, that should not be the case. But that's just a testament to how great our residents are. And that was something I was talking with Ben earlier today about, just how nice this community is when I arrived here, and just getting used to how nice everyone was a pretty big change for me. And he used the right word in terms of humility as well, and just everyone here doesn't believe they're the greatest people in the world. Everyone's just very humble and just very nice and appreciative of everything. So it's a great community to be a part of, and our residents and everyone who was showing up was great. But it was also just a great effort, because we did have people in the surrounding areas, even coming from Fairfax County. And when you listen to them, because police and we were talking with people in the line as well. They were people who weren't working since March, because they have someone in their household who they were really worried about that would get COVID and they would die. So they made a decision not to work from March. So these were people who were who really, really needed it and who would bear the cold to come out and actually get it. So I think it was a worthwhile effort. I hope there will be more events like that in the future. Right now, that it doesn't seem to be the case that they want to kind of stick with the wait list, but we demonstrated that we can get a lot of people through, and a lot of people are willing to kind of wait the lines because they're in desperate situations. So it's kind of heartbreaking to see families who were, who really were concerned because they have some major underlying health conditions, or a lot of seniors. I would say probably 30 to 40% were seniors as well, who were coming out to get their shot. So it was a great effort to keep our community safe, and it was a good opportunity for the surrounding region, for people who just felt like they didn't have anywhere to go because they were just unclear with what was happening with the wait list, and they were willing to, gut it out there because of people that either themselves or people in their household who they're really worried about getting COVID-19 and being one of the victims of it. So.
Well, there were so many compliments, either by phone, by email, on Facebook. I mean, very well received.
Yeah. So again, we're very lucky to have the MAP Clinic as well. Whoever put that together a few years ago, I'm sure it was a team effort, but should be commended, and all of the staff and governing body who made that happen and continue to make that relationship work, because they're a great resource for our community. I hope in the future, as healthcare continues to become a bigger priority, there's additional federal funding opportunities to really help that clinic become the reality, what it should be, and grow to service our people in our community that we really need that support, the underinsured or uninsured people as well.
We need the feds to step up on a lot of stuff.
Yeah. Again, thank you all again last year for letting me hire Keith. So that was a huge allows me to keep working on the downtown stuff while we have a good COVID-19 response as well. So, was there a question? I'm sorry.
Yeah, this is Preston. Hey, kudos to you too as well. I mean, you and Keith and the PD and the CERT team, you made a really good decision on Friday morning. I mean, it was freezing cold, and people were waiting in line, and they got their ticket, and you told them to wait in the car. And that was a smart decision, because that it was very uncomfortable outside. It was that cold, and I think it helped it make it more convenient for them to suffer the wait for the vaccination.
Yeah, I didn't want especially seniors catching pneumonia while we're trying to help with healthcare. So we have to come up with a way to keep them warm while getting vaccinated. So keep them healthy while getting healthy.
Right.
Yeah. Okay, so the first item that I had tonight was it's an organization called Smart Beginnings. They service the similar like to the Prince William Health District. They service our area, Prince William County, City of Manassas Park. Their ultimate goal is to help create an Office of Children's Services in this region, similar to what Fairfax County has. Actually, from the county website, their Office for Children is called in Fairfax County. I just kind of printed out what their mission is, kind of the different services they offer, and below you can see their featured service, how their goal is essentially to connect their residents birth to K is kind of a priority because of just, not the universal educational opportunities, and especially underserved communities, to get connected, potentially get funding support for early childhood education, but also continue to provide ongoing support through the elementary school process. This was the organization that really took the lead in Fairfax County to help with the ongoing kind of educational support during COVID-19 as well. We didn't have that resource. They were great in kind of setting that up throughout Fairfax County to make sure that their kids weren't falling behind. So they really focus on partnering with their social services department, who does some of the funding support for childcare, their school system, who has the early education programs as well, and other private providers as well, and connecting underserved communities to those resources, because a lot of them, of course, aren't going to have those resources in place to start taking care of their kids. And of course, the science is pretty clear about the importance.
Another reason they focus on the 0 to 5 is the vulnerability of the brain at that age in a child, and how important it is to start learning early.
Yeah, that's exactly the point I was getting to, with the science behind infant development and the ability to learn, just the cognitive development in the first 5 years, how critical it is. And that's what this group helps with doing. Now, do does this office have the resource to provide that education? No, their goal is to really connect people to try to give them the maximal support, connecting them to programs like our Parks and Rec preschool program, right? Potentially getting funding sources to help out underserved communities with getting that access. So Fairfax County has one. The goal of this group is to get one created in the Prince William region, Prince William County, City of Manassas, and City of Manassas Park. So they reached out to the mayor and Councilmember Mensing. They had a meeting. The mayor followed up with me, so I scheduled a follow-up call with them just to understand a little bit more of how they were structured, what their goals were, resources, all those questions, see what their conversations were like with the county and the City of Manassas. And so before we invest a lot more resources and time into kind of investigating this program, we wanted to have kind of that initial conversation with the entire governing body about kind of utilization of tax resources for a program like this. What kind of structure do we want to have with the county? Because as we've seen, we want to make sure if we're going to do something like this, if we're going to use these critical tax dollars for a program like this, we want to make sure we have representation in our city as well, that it's not just going to be centralized in the county, but that we have representation here in our city that we can coordinate with, that we can make sure that it's directly serving our residents as well. So a little bit of background as we were kind of negotiating the next steps for the library, we were looking at a structure a little bit more similar to kind of how our fire department does it, where we have centralized dispatching, but there's sovereignty within each jurisdiction for kind of their own fire services. We're looking for a more similar approach to that for like the library, and we really believe that that's a better approach for these different services that happen at the counties, making sure that we have a person or an office in our jurisdiction as well to service our residents, because we don't want to just give the money to the county and then all the resources are in Woodbridge or some other parts and our residents aren't necessarily able to easily connect with them. So that has to be kind of a decision point here. Or do we agree that we'd want to do something like this, but only if the structure was right, only if we had made sure that we had some kind of representation in our city to serve our community. And again, is this a priority initiative that you want me negotiating with the city manager of Manassas, county executive of Prince William, just like we did with the library, where we just go through kind of sessions of debating how the management structure should be for an organization like this, what should the resources be, staff levels, budgets, things like that, that we can come back to all three different boards and present kind of a consolidated proposal. That's going to take some work. So again, is this kind of a priority that we want to tackle right now? And those are kind of the decision points that we want to raise in kind of the manager discussion to see if kind of what steps you all would collectively like city staff to take on this initiative. So thank you.
Thank you, Laszlo. Everyone should have received the email that I sent. I wanted to give you enough time to think about this. So let's start with the folks at home. Councilmember Moore, comments, questions?
At this time, I really have no questions other than I hope we put this, will this be part of our budget prioritizing process? Or are you asking us to do that tonight?
Well, it's not necessarily a budget prioritization. Right now, it's more of a planning prioritization. Like, is this something you want us to have ready for this budget season? I'm not sure we can, because I know the county and Manassas, their budget timeline's a little bit sooner. So I'm not sure they're ready to put something in their budget. It may have to wait for next budget cycle, but it's really about, you want us as a staff to start really focusing on, or especially myself, on trying to get this office created for the region and engaging with the county executive office and the city of Manassas city manager office to talk about how to properly structure this thing to make sure that it's balanced across all the jurisdictions. So just like I did for the library, where we negotiated kind of the future of the library, and it was kind of a multi-month process, is that something we want to take on for a program like this? So it's more first of a management priority from you all, delegating down to me for a management priority before I come back with an actual budget proposal. But before we even get to that, though, is that, again, you have to determine, would you even be interested in kind of funding something like this? Because if the answer is no, then we shouldn't spend the staff time on preparing a budget proposal either, if that makes sense.
I appreciate that.
Yeah.
But it seems these services seem a little duplicative in what we do and what the county currently does. Can you help me understand how this will differ from what we're currently doing in our departments and what the county is doing?
Yeah, so
what the school district as well.
Yeah, I think you're right. I think there is a lot of overlap. And again, these departments don't necessarily have the resources to do the direct education. I don't know if they'll ever grow into that or not, as potentially federal funding for initiatives like that happen. But if federal funding happens to that, I'm not quite sure if it would come through these kinds of structures, or if it would feed directly into the school systems or not. But you're absolutely right. So the schools manage their own preschool programs like Head Start. But again, that there's a logistics behind that, right? There's an application process, there's an outreach process. What these organizations do is help kind of the underserved community navigate through that process. Dealing with kind of pre-K education is not that simple, whether you have an IEP or just looking, if your income constrained and you're looking for those kinds of programs. There's kind of a bureaucracy behind that. So these organizations help kind of support you in that effort, and also finding other private providers and potentially providing funding resources. But you're right, the Parks and Rec Department provides a preschool program. The schools provide a preschool program. There's private providers of pre-K education. And this is kind of more like a central clearinghouse to let the community know about all those different efforts, and helping residents kind of connect with those efforts, help them navigate the process, especially of kind of the more kind of income-based application processes. They can be overwhelming, especially for members of the immigrant community as well, to navigate through some of those programs as well. So it's almost a facilitator for underserved communities to help them access these resources that, you're right, are provided by other people.
That's all I have at this point, but I may have questions further on. Right now, it's just
And you're right also about our DSS does provide child care funding for people in need.
So what age does the preschool serve? I mean, this is 0 to 5. What's the age, the primary age of service for preschool?
I think so. For the school, you're saying, for Head Start?
For school, it's 4 years old.
Yeah.
For
4 years
preschool.
old. So 4 and 5?
But the community center, I think, had 2-year-olds. I think it started with 2-year-old. Was it 3-year-old?
Yeah.
Okay, 3-year-olds.
It's 3 years old. It's probably the youngest.
3-year-olds.
Yeah,
3 years old.
3 and 4, they kind of graduate different levels.
Okay, so, and this would focus from 0 to 5?
Correct, so you're right,
Okay,
it does
yeah.
provide additional.
So there is a slight difference there.
Correct.
Yeah,
And that's
okay.
really the private sector that does that for people who have means.
Yeah.
They're able to get their children from the start, kind of
Right.
these extra services to help with their development in the first
Right.
years.
And Councilmember Moore, you were right on point in that eventually this will have a budgetary impact. Right now, as Laszlo says, it's to determine if we even want to have him, because his time is valuable also. His time is a resource. So what we're trying to decide is if we want him to initiate the process to see if it's something that we wanted to become involved with. So your question about revenue and budgeting was on point. Do you have any follow-ups, Councilmember Moore?
Well, my last comment was, I thought tonight's presentation that we heard talked about prenatal programs at the county level. So I thought they started from 0 to 5 as well. But, that was my only comment.
Okay. Councilmember Javed?
Yeah, I mean, it's the time we're in is, this whole COVID-19 pandemic. A lot of these families lost, access to these crucial services like, daycare and preschools and services. So, I mean, and a loss of job income. So if this, foundation can help the underserved community find funding or find ways to help pay for these services, I mean, I think this will be a plus for our community, especially for the younger generation as well, because we don't want them to feel that they're not able to get preschool, access due to limitations of what's happening during these current times right now, during the COVID pandemic and job losses and the whole, minority group, the racial injustice. I think this is a good thing, and I would be in favor for it.
Okay. Okay. Thank you. Vice Mayor Banks?
I like the intention and the office itself, but I think it is sort of duplicative, and we don't have the resources, staff, as well as in the future financially, I think, to be able to handle this. That's my only comment.
Okay. Thank you, Preston. Councilmember Hampton?
Where I think this has, as to echo what Preston said, it has good intentions. When I looked at the website, I did see that they already have a relationship with the 3 different jurisdictions, not the jurisdictions, but the school districts, including Manassas Park. And I also think right now we have other priorities that are really more demanding on the entire of the city. So I would not entertain it right now, maybe a year or 2 down the road, but not at this moment.
Okay, thank you. Councilmember Mensing?
I was fortunate enough on the school board to be able to go to the Virginia State Association conferences once a year. And after 3 years of going and attending many different lectures and talking to people all over and at different levels of the school districts, the theme that they always came back to was if we could have only gotten to them sooner. Kindergarten is not soon enough. I've heard principals saying that they've had children who have never even held a book when they get to kindergarten. So I cannot stress the importance of this and the urgency of this, because when we begin this young, it molds the future. So I absolutely support this.
Councilmember Amaya?
I think it's something that's needed. I don't understand how Manassas Park would be involved in the office. If you're saying that there's already other offices around the area that are already providing the service, I guess I would need more information as to how it will go, but it's something that I think it's necessary as well for the community and for the kids. So I'm for it if it's going to be something that's doable.
And so there is no office in Prince William County that does this. There is one in Fairfax County. So again, we haven't decided on kind of we haven't agreed to anything. This is just a nonprofit at this point who's advocating for kind of the creation of this structure for the Prince William area. So ultimately, again, it's going to have to require approval from you all, approval from Manassas City Council, and from the County Board of Supervisors as well. So it's really kind of it's not simple, right?
Right.
We have shared services, like you heard tonight from 2. Those 2 are different in that they're also quasi-state entities as well.
So is the question that we're asking now is if we want to share the burden or the resources with Prince William, or do you want to take it on ourselves? Is that the question?
Well, I'm not even asking about doing it ourselves. I'm not sure we have
actually,
the infrastructure.
the question right now is, do we want to have Laszlo interact with the chief administrative officers of Manassas and Prince William to try to work something out and bring back to us? It's not a commitment to spend resources right now. It's, do we task Laszlo with that?
Yeah.
Does Laszlo want the task?
I think we've had a lot of challenges since coming on board here with finances, with debt management, with the pandemic, the Mosby. There's just been so many things. The downtown, it's a lot of work. So this is a noble effort. I can pursue it. I'm open to having a meeting first with the county executive and the city manager of Manassas to see kind of where they're at with this. Are they even entertaining?
Right.
Will they even entertain something like this? If the answer is no, then stop right there, right? Then it goes back again to the boards. Are the boards going to tell them we'll figure this out or not, right? If they are, then yeah, I think we'd want to be a part of it. So this group is engaging with them right now. So the question is, do we want to be left out of that conversation or not? And so if they're engaging with them right now, if they're willing to entertain that right now, then the question is, do we want to be left out of that process? Do we want to be part of that process? Because I don't think we would have the financial resources to do this ourselves. This would be a shared service, just like the library used to be. and we pulled that back to the city, right? Because we looked at the numbers, said, hey, we can do this ourselves at a lower cost, and we did. We're always, that's kind of we need to look at it that way as well. It's kind of another shared service that we'd be adding to the budget category that says contribution to the county for CSB, contribution to the county for courts, contribution to the county for X, Y, Z. This would theoretically be one of those. What I'm advocating is that we don't accept it unless we learn our lessons already about how difficult church services are, unless you have representation in your jurisdiction. Someone that I can literally walk over, talk to about this, or invite to a staff meeting to coordinate with the other departments. If you don't do that, you don't get the same kind of support infrastructure that you would if, again, I'm not, with our limited financial resources, I'm not advocating just sending more money to the county and letting them, the county board of supervisors, vote on what the annual budget will be, all that. I think we learned our lessons in the library. That can't be the case. We need to have more of a say on these shared services in terms of what our budget capabilities are. So that is my one recommendation: is we don't just accept something where we're just sending a blank check to the county where they get to determine what the budget for an office will be like this for each year, and we just have to pay to remain part of it. But that we have representation and we have some kind of say in the budget process as well.
Right.
Is what we learned when we went through our peak debt and we were evaluating our budget cuts. We had no control over those budgets, and they were going up while we were everything else was going down. Right, so we really want to maintain as much budget sovereignty as possible.
Okay. I just want to mention, although this is not a consensus whether or not to spend money tonight, from the numbers that I've seen, from the staffing and the administrative costs, now please don't hold me to this, but our Manassas Park share might be $10,000 a year. Judging from the numbers that I've seen and the numbers that I've heard. But like I say, please don't quote that. Don't hold me to that. So, Councilmember Amaya, you said, were you a yes or a no? I'm sorry.
Yes, I'm for it if it doesn't create more of a task for him and get us off budget.
Okay.
Yeah.
And from what I heard from Laszlo, you want a trial balloon meeting with the other two. Okay.
Yeah, just to see where they're at.
To see where they're
I
at.
think Smart Beginnings has been engaging with their elected boards or members on this. So I'm certain they must have heard about this before.
Okay.
So my recommendation to Smart Beginnings was help facilitate a meeting between the three management offices and see, what's the agreement on how this organization should be created or structured. Because Manassas, I think, is sharing more and more of our perspective in terms of not wanting to just create a new county office that they're sending money to. We really want to, even though, again, we're smaller in terms of population, these are still our taxpayer dollars, and if we're investing them, we want to make sure we have some control over what we're investing and we're getting a return on that investment of taxpayer dollars. So I think that should be the first. I think I should be able to do that, and then it just maybe we hear back from that meeting, see kind of where they're going, maybe I can come back to you. I'll just kind of give you a feel for what the staff perspective is from the other jurisdictions about what they'll be proposing to their respective boards.
I think that would be a good.
Okay, so what I've heard so far is Councilmember Javed is a yes. Vice Mayor Banks is a no. Councilmember Moore, I'm not sure that I registered what your preference was.
Well, if we're talking about this balloon meeting where he's bringing people, managers in to talk about it, sure. If he feels he has the bandwidth to do it, go for it. Bring the information back to us. If there's interest, then we could discuss it further at that time.
Okay, and Councilmember Hampton was a no.
Well,
okay. Go ahead.
I agree with having that informational meeting so we can find out where they're at, what the next steps are, and then bring that back to us. This way we can make a more educated decision, because right now it's pretty vague about everything, including what the relationship is with Manassas Park City schools and this organization. To go back to Daryl's point, try to prevent duplication of efforts.
Right, and the schools would be included. So there'll be 3 divisions and 3 jurisdictions. So that would be a total of 6 people.
In that meeting, on that call?
Yes. exactly.
And they're a nonprofit right now, and like Randy Knights, our DSS directors on that board, and I believe they have a member from our school, school staff who's also, so they've been actively making sure that, again, I was kind of joking with them that you're dealing with 6 jurisdictions essentially, right? Your 3 schools and your 3 city county entities as well. So you need to make sure that you have representation from all of them and agreement from all of them. And to council members Moore's point, we don't want to be duplicating the efforts. We need to figure out how are they fitting in? How are they coordinating with DSS for the services that DSS provides? How are they coordinating with our schools for the services that our school supplies, Parks and Rec, et cetera? And that's why, again, I go back to my point, unless we have some kind of representation that my staff can coordinate with, it's hard to do that. It really is when things are kind of centralized at the county level.
Right. Just
oh, I'm sorry.
Yeah, just bring back the information, and this way I can digest it. Because right now, looking at the website, it's pretty vague.
Yeah.
And
the information that we received was not as specific as we need.
Right.
Yeah.
And I'm not going to make a decision based off of vagueness.
Right. So Councilmember Mensing is a yes. Councilmember Amaya is a yes. I'm also a yes. I had a thought and lost it. Must not have been important. But anyway, Laszlo, I guess the consensus is yes. Yeah. Okay. And I will respond to Smart Beginnings and let them know that although this is a trial balloon, this is the meeting, it is not the commitment. It's not the total commitment yet. We need more information. Yeah. Okay.
I will have, I know that all jurisdictions are having financial issues right now with COVID, so that might be a detractor right now.
It's not a good time to start this, actually. Yeah, it's not.
It may just be that we at least try to get the organizational idea in place for what the future could be, but I'm not sure. I hate to speak for the county on that, but just by engaging with all the different jurisdictions, I know there's a financial crunch right now that everyone's facing.
Okay. Well, thank you for your willingness to have this trial meeting.
Yes,
I know what I was going to say. When it comes to representation, we don't want to be in a situation that we were in with the library board, because we were terribly underrepresented. Manassas City was terribly underrepresented. So I had made a suggestion to them. I don't know if they'll be able to do this, but the representational model from the Upper Occoquan Service Authority is really a very good model. It gives the cities a strong voice. There are 4 localities that are a part of UOSA: Fairfax County, Prince William County, Manassas, and Manassas Park. Each locality has 2 representatives they send to the UOSA board meetings, so that there's a total of 8 board members. That means that Manassas Park, though we're a small city, we have 25% of the representatives that attend that board meeting. So it's a really great model. I mean, if they could accomplish that, that would increase the voice of the city if we decide to go forward with this. So
there's always kind of if you're in the county's perspective, it's like, well, we're the biggest organization. We're going to put the most money in this. It's been a debate
so that may not happen.
Our nation's history between the New Jersey plan and Virginia plan about how you balance representation between smaller jurisdictions and bigger. But I agree, like before we commit to funding anything, we better make sure that we have adequate representation.
Yes.
And staff representation as well.
It feels like we're more in the driver's seat. Yeah. Okay. Thank you, Laszlo. Okay. Moving on to Public Works building discussion.
All right, so Public Works building, as a reminder, I briefly touched on this during the City Hall presentation where I said, well, we had 2 unfunded capital liabilities that we were aware of. They've been in the CIP for a long time. When I did my first budget recommendation, I moved it to an unfunded capital liabilities tab in the budget spreadsheet because we clearly just don't have the resources to finance projects like this. So clearly, City Hall is being taken care of via the development itself. What we've been talking about over the last few years is the potential to go out and acquire an existing industrial facility that's newer to service our community development department, public works department, and potentially some of our school facilities in one building. We have 3 new governing body members. We need to come back and make sure that there's still general agreement with that. And the reason why I need to come back to you all now versus later is because when you're going to look at the budget, there are facility needs for the public works building. I've spoken to Kenny. He thinks he can keep things kind of going if, as long as we're kind of committed that in a few years we're going to be buying a new building. He would hate to throw a lot of money into that existing building. So decision's not needed tonight, but I really want to start talking about, maybe we bring it back at the retreat. But we need to make at least for our CIP, we're going to be presenting our CIP next week to the Planning Commission. We'll have these items there, but I really don't want these spending items on Public Works to remain on the CIP some of them are for FY22, if we're committing to using these proceeds to buy an existing building. And in this slide, you can see the cash that we'll have on hand after the City Hall deduction, right? Some of the proffers and land values are actually going into the City Hall budget as a deduction to reduce the price tag. Other is coming in form of direct cash to the city. That's kind of the rough number, the $8.6 million in general fund cash over the next 4 or 5 years coming in, and then $5 million in enterprise fund tap fees. And why I list that enterprise fund tap fee revenues, because this is a public works building, community development department, half of what they do is servicing the enterprise fund, so we're legally allowed to use that money as well for capital infrastructure, including new facilities. So we have more than enough money to fund other capital priority needs as well. But I'd also want to see if we can get some kind of consensus that yes, we still like that idea of trying to acquire another building utilizing some of these proceeds. Therefore, do not have on the CIP new roof for Public Works, new HVAC, these expensive projects for the existing building if we're going to end up moving away from it in a few years. So I want to start having that conversation tonight and get a feeling from everyone about what their perspective is on what they want to do in the future. If they want to just try to renovate that building, keep putting the money into maintenance of it as a facility, or do we want to look at a different option that's going to be more.
Is it structurally sound?
I think so. The roof, it has a lot of issues in the whole building. Definitely you're going to be investing a ton of money in just like our older fleet, right? In a lot of maintenance, a lot of repair issues. You're going to be throwing a lot of money into that building if you want to keep it. That is an option, but that's why we want to discuss that now, because you're going to see then if we're staying there, then I'm telling them to do a full-on kind of renovation plan to keep that building going.
The reason I asked that is when they went to demo the old Parks and Rec building, that came down really fast.
Okay.
Really fast. And I have a feeling if we went to demo the Public Works building, that might come down really fast. So naturally, I'm asking myself, is it structurally sound now?
Yeah, I would have to ask Calvin and Kenny what their perspective is on that. I would hope so. Yeah.
I worry about hard storms, things of that nature.
It's a very old building. I'm talking to Kenny and Calvin. A lot like the roof, they don't think that's ever been replaced since.
Oh my goodness!
Building, which was I think in the early 70s.
Okay.
The HVAC, a lot of the materials that are part of the HVAC are also probably in the 80s or 90s. So again, it's extremely old. It's unfair to our employees who have to deal with that building. So, and again, we may be able to get a facility that would put the department finally together in one building, because right now they're spread across, which makes it very difficult from a management perspective for Calvin to be in Calvin and Carla. We're really supposed to be supporting the entire department. They're here at City Hall. You have your Public Works crew, your fleet crew in that facility. We can get them all in one building, take advantage of then the sheer kind of economies of scale from a customer service standpoint as well. It really helps them as a department as they grow as well to satisfy their facility requirements. This does not. And then also potentially, again, I think you're going to see it on the school CIP request. They're going to be asking for that transportation facility and their facility maintenance facility.
Yes.
And how are we going to fund that? Are we going to build a new building for them, or do we want to kind of merge these two as one approach, buy an existing building for a lot less than what it would take to build new buildings that, again, comes in the same timeline as when we built all the other city facilities? So then the next step would just be, okay, what's our renovation plan for the 2030s, right? We put that in the same bucket versus what's the new building plan.
So would some of the funding for this come from future phases in the downtown area?
No, that we have more than enough in the phases 3 and 4. Yeah,
Okay.
if we want to commit to it.
I see.
Yeah.
I see.
And again, I'm not going to put a dollar amount because I'm going to be negotiating.
Because we don't know, yeah.
Right, now I'm
first of all.
negotiating purchase. I've already spoken, I already have,
Yeah.
ideas in my mind, I already spoken to owners. I kind of know what's probably, but again, I don't want to put us at a worse position when they're trying to negotiate an agreement for a sale price. I want to, again, always represent taxpayers to try to get the best deal for us. But just, yes, we have more than enough money, more than what we would need to acquire a building with those revenues that are coming in, just from phases 3 and 4.
Okay.
Yeah.
Okay, that answers it. Okay,
That's the value, again, of those developments. Not only New City Hall, it gives us the cash to deal with this unfunded liability and other profits to help us with tax rates and other things as well.
Okay. Let's start with our folks at home. Councilmember Moore, do you have questions or comments?
Well, I think that's what answered my question. You're saying it's cheaper to buy a building as opposed to take the $13.6 million and build a building?
Yes.
To our specifications?
Yes, absolutely. Especially if you're going to build the schools, their transportation and this facility maintenance facility, you're going to be spending a lot if you're building now. You're talking about building 2 new buildings. Yeah. It would cost a lot more than acquiring an existing industrial facility that could potentially satisfy all those requirements.
Okay. The other piece is I am a strong proponent that we should do this in conjunction with the school district and their transportation facility needs. I think the facilities should be combined. I think we get some economies and skills in doing that. I think as we go forward, we should think of that option.
Yeah, absolutely. I agree with you. And that has been floated, I believe, already. Okay. Do you have a follow-up, Councilmember Moore?
No, that was it. Thank you.
Thank you. Councilmember Javed.
Matt, are we saying to defer all repairs until the acquisition?
We're going to do minor, so Kenny's going to do kind of minor things to keep the building somewhat functional, but major, like a new full HVAC system or a brand new roof. Those are the things that we're going to talk about deferring if we're committing to in the next few years as we get this money to go out and acquire that building. Because again, it wouldn't make sense to put a lot of money up front into the current building when you're going to end up tearing it down in a few years anyways, or just not using it. But again, the plan for that site again is some kind of economic development, redevelopment of that site to match the Kent Village Square development. So we expand the retail opportunities for the west side of our city, not just our downtown area.
Yeah, I'm just worried, like, if the roof is really old and say something does happen before we get that revenue from the downtown, then we would have to spend that money, right?
Yeah, that's of course. You're absolutely right. If there's, just like with all of our capital that we've been deferring, sometimes things break down and we have to fund things sooner than what we would like. We do have a facility manager now on the team, thanks to the governing body about a year and a half ago approving that. And Kenny's great, and he's going to do what he can again to keep the building functional here over the next few years. But you're absolutely right. That's a risk with all of our capital that things can fail. Even our newer capital, we see that with the roofs, like in the high school, elementary school, our police station that we built, 12 years ago is already having capital failures as well. So that's kind of a reality for all capital projects is you're going to have some failures that come sooner than what you would like in their kind of emergency procurement requests. But hopefully we can defer that.
Right. Is the future public works department going to be at the same location?
Yeah, we want to put the community development department finally all together. So all the staff that are in the city hall. That'll also free up space in the new city hall to allow, again, staff to grow in the future, because when we got rid of the 4th floor, it's tight now, right? By moving Calvin and his team from City Hall to a new community development department, that opens up a lot more office space in the new City Hall for future growth requirements of city staff as well from the administrative side that we just don't have right now.
I mean, I guess in your opinion, right now, is it anything urgent that we would need to do any repairs at the moment? Or can it be deferred like you're suggesting?
Yeah, I think, again, we can use the operating budget to keep things going At least that's the current assessment, that we can keep things going at the building, just like we're doing for City Hall, without expending any CIP projects. We are still investing in the maintenance facility, because even post, when we get first of all, we don't want our employees working without any HVAC system, and that's what exists in the fleet building, so we're still working through with that. But that building can also be utilized for other purposes once we move fleet and public works to the new building. That can then open up opportunities for making that kind of the training facility for our PD and fire, or additional storage space for the city. So we're going to continue to invest in that.
And my 2 cents. Yeah, no, I was just going to say that. Can you hear me?
Yes, we can hear you.
Awesome. Yeah, I was just going to say, no one wants to work in an environment that's not safe or unhealthy. So we could still do these repairs and then also do the acquisition later down when we have more revenue. But deferring these capital, if the roof is like built the original roof, I mean, if it comes down, then we're going to spend our money anyway. So why not get ahead of it?
Yeah, I think you can take the risk, because if you don't do it right now, this is kind of like a decision tree. If you don't do it right now, then there's a good chance that you won't spend that money right now, and you're good. If you spend it right now, you spend it right now, right? So you're not really giving yourself options. So I think the option of trying to defer is the better one, because then there is a chance that you don't end up spending that money on the existing facility, right? You're absolutely right. It could happen where we end up having to spend it. But if we decide to spend it right now, then we're 100%. The decision is spend it right now. So I do think we should take that opportunity and take that risk of trying to save that money. Again, if the phase 3 timeline and the phase 4 building, the first residential building and the phase 3 units come online, we're talking about potentially in 2 years being able to acquire this building. If we're that committed to it. Because of not just, we may not have sufficient profit cash in hand, but then we will have the tap fees as well for those buildings. And also phase 2 will likely be coming online as well. So, staff's recommendation again is that we try to defer as much as we can if we're committed to getting a newer facility, so we save that money and we come out of it stronger financially for not having spent that money. But you're absolutely right. We can do that right now if you all want to, and that will preserve the life of the building a little bit more, and it gives us more time to go out and buy a building. Again, that's going to be your discretion.
But it still is an unfunded liability, even with the new roof. Okay, I see.
You're going to want to, again, unless we're comfortable with our public works crew working in that building for another 20 years, right? We want to do something, either renovation or a new building or acquire an existing building. Something has to be done for public works.
Okay. Do you have a follow-up, Hasib?
No, I don't. Thank you.
Okay, thank you. Vice Mayor Banks.
Yeah, I'm concerned about the unfunded liability of us getting caught in a squeeze where we are committed to something which we don't have funds for. And then I'm concerned whether or not whether the facility you have in mind actually meets all the needs of public works building, right? Because they need storage space too, yard space for storage.
Yeah.
And if we're going to combine with the school facilities too, we may need a very large building.
Yeah, I do have one in mind that would meet the requirements. And in terms of yard space, again, we wouldn't redevelop behind the building where you have their public works yard, the salt shed, and the fleet facilities. We would keep that for the city, because you're absolutely right. You want to maintain that as a potential asset. But you're right. We'd have to identify the building that would satisfy all those purposes.
So let me get you right. So if we move to a new public works building, the old one is still going to be for public works. it's not going to be rezoned like for commercial or anything. It's still going to be public works.
There's two buildings, and 3 if you want to count the salt shed, that are at the existing site. There's the actual public works building, then there's the fleet maintenance building behind it. That's part of the fleet or the public works yard, and then there's the salt storage facility that's also next to the fleet. So what we would recommend is that we do redevelop only where the public works building is, integrate that with Kent Village Square as additional commercial for the city, but preserve that yard, the public works yard, the salt storage, and the fleet maintenance building to make sure that we have another, that public works will continue to have access to that facility. We can keep this one as well if you want to keep additional extra space for public works, but I don't think it would be necessary if you get the right building in place. If you acquire the correct building, we shouldn't need this building here. That's on the picture.
Well, your first mention was spot on. I was thinking the same thing because Kent Village is where you're seeing the businesses fill up those vacant spaces. So I would think it'd be wise to try to expand that development for the old public works building. Okay, thank you.
Yeah, absolutely. I think there's a big market there. You can see that those retail establishments, they do pretty well. They have people going there. You're absolutely right. Now it's fully leased, that building, and you have a strong market not just from our city, but kind of the Lomond area, kind of going into the county and neighboring city of Manassas. Unless people want to go to Sudley or to 28, that little shopping center serves as a very convenient shopping location for them. So again, I'd love if we could get kind of a smaller, a lot smaller market grocer there as well to kind of service that community. Because Mega Mart can be a difficult process. So something a little bit more convenient during the week, and then maybe make Mega Mart your kind of once a week stop for more purchases. I think it can service the community over there.
Yeah.
Thank you.
Okay. Councilmember Amaya?
No questions. Thank you.
Okay. Councilmember Mensing?
No questions. I support. I support holding out and going to a new facility.
Yeah, likewise, I do too. Councilmember Hampton?
Quick question. What's the time frame where we're looking going to the new facility? Is it 2 to 5 years?
I think so, yeah.
Okay.
That's a good timeline.
Okay.
And again, negotiations, things like that.
Right.
But yeah, I think I'm hopeful we have enough money in 2 years and start the negotiation process, acquiring. When you're acquiring buildings, I think that the one holdup could be the existing leases, right? Giving them time to move on. So that could present a hiccup as well. But again, whatever facility we identify, we don't need the full use immediately, right? We can kind of slowly grow into that as well.
Okay. I'm all
cross the fingers that we'd be able to move in.
Knock on wood. I'm for it because let's face it, that thing has been in existence almost as long as I've been alive. So, it's time for a new building, and it served its purpose. Police department, fire department, then just fire department,
absolutely,
and now public works.
Do you have sufficient guidance?
Yeah, at least I believe there's consensus to try to defer as much as we can from the capital side.
Okay.
Calvin and Kenny just doing kind of what's necessary to keep the building functional. And then as we get these proceeds, I'll bring back to you all purchase options to finalize.
Okay.
But again, that's going to be minimum 2 years.
Okay. Councilmember Javed, did this come in over the chat or was this just an email that came in? That
came over the chat.
The chat. Okay, well then I'll go ahead and read it. This is from Smart Beginnings. On behalf of Smart Beginnings, we thank you for your consideration to move forward in obtaining more information regarding establishing an Office of Children. 90% of a child's brain is developed before the age of 5. Research shows for every $1 invested in early childhood, $17 is saved because children are less likely to repeat a grade, need remediation, more likely to graduate from high school, more likely to attend college, mothers are more likely to be employed. We appreciate your time and attention to the youngest and most vulnerable children in your community. They are the workforce of tomorrow. Smart Beginnings, Greater Prince William. Kathy Channel, Chair. Tanya Soltis, Executive Director. Gina Parr, Secretary. Thank you. Okay, moving on to our next discussion item, roof discussion.
Don't have much for this one, except that, as we're aware, that the schools were looking to do their roof repairs as part of their CIP presentation. They requested as part of their budget amendment. They've been doing more work on it. I did receive an email request from them a couple weeks ago to see if we'd be interested in doing a joint RFP, because they've heard that might be an interest from governing body members as well, since we have the PD roof. The PD roof has been on the CIP is for FY22, but again, the CIP is more of a planning document. If it's not FY21, that means there's no funds for it. So in order for us to join, they're ready to issue their RFP, right, to get back pricing. And it kind of makes sense to do this now because you want to do the work in the summertime, so you really need to get the RFP process in place. So again, this is almost kind of coming back to you all and saying, are we still committed to doing the police roof? I didn't include public works review, and that was going to be for FY22, but that was based on the previous conversation. But for the PD roof, if we're committed to really doing that in FY22, and just as a reminder, we have about $150,000 budgeted for that. Whether that'll be the final price or not, it's difficult to say until you actually go out to bid.
Probably not.
Probably not, yeah. We learned when we went out to bid for the registrar facility, prices can go up. Although roofs are a little bit easier than full-on office space, the prices I think are going to vary a lot more.
And just to clarify, my understanding from the engineer that addressed the school board was that although it's ideal to do it in the summertime, it can be done when school is in session, providing there's coordination with staff.
Yeah. For us, though, because it's FY22, we would wait until the summertime to get it done, because it's not part of the FY21 budget. So I think the timing makes sense. If they're ready to go right now, if we're interested in doing a joint RFP, that would be kind of the first decision that I can go back to them and say, yes, absolutely. The next decision is if we're doing a joint RFP, or is it just the RFP, or do they have their own budget in their schools? We have our own budget in our city schools. Do we want this to be a city capital line item for both, since it's going to be city money for both, unless they're getting, I don't know if they're getting state money for their roof. I doubt it, because usually the state's not funding capital facilities, so it's likely going to be city money. So if you want this to be a city project, or their project and our project kind of separate, and that's pretty much it. So this is more of a simple item from my standpoint, but it's really just more of a discussion for you all about.
And it's an important discussion, because we know the roofs in the city that need to be done. I think it might be fruitful for you to go back to the division and say, well, the city can issue a joint RFP, economies of scale. Would you be willing to go back? I mean, if it's a consensus of the governing body.
Well, that's what I'm here for. So if you all agree we should do this, then
I mean, we would have, if the city did this for the two roofs, there could be economies of scale. Even though we don't have our assessments yet, we really need to know how much revenue we're talking about. So I think it is productive to get the RFP out. I think if the city does it, we would learn, first of all, how much revenue we have. Second of all, there'd be transparency. All staff on city and division would have access to all the documents that were generated by this project. And I think actually it could be savings. It could save us money. So that's.
I think they discussed it last time it works. I think they're open to this idea.
And not just what is the cost to do it, but also what is the cost to phase it in, because we don't know that we're going to be able to afford this, and it can be phased in. So let's start here. Councilmember Hampton.
So I've seen firsthand the damage over at the police department.
Yes.
I haven't seen the schools, but the police department's pretty substantial.
It is. It's down into the electrical room.
Yeah, which is coming from the daughter of an electrician. I can tell you that's really bad. So I'm all in favor, and this is something we do in the corporate world as well, is we join forces to go out and get the better price. My question is are the, and I can't remember the details, but are the roofs kind of the same or are they different?
I believe just talking over with Calvin and Kenny, I believe they're very similar.
Okay.
It's kind of the same membrane structure. So I think you can do, from my understanding from Calvin, you can do a joint RFP. But again, the next step, if you guys want to do this, just to let you all know from a staffing perspective, is I've reached back out to Eric now, say yes, there is interest, try to get a meeting scheduled with Eric, Mr. Paul Simpson from the schools, with Calvin and Kenny on the city side, and talk it over kind of, so Calvin and Kenny have a better understanding as well, and then they can talk about what the RFP process would be, and then we can bring something back to both boards.
Okay. And I am in favor of the idea of a full scale, give us some choices here.
Yeah.
Full scale replacement or a stopgap that'll kind of hold us out for 5 years until, things are a little bit, the revenue stream is a little bit stronger. So just give some different options.
Like phasing it in.
Yeah.
Yeah. Okay. Councilmember Mensing?
Yeah, all of that. I agree with all of that. And I like how we're kind of more in the driver's seat for this one.
Yes, I agree as well. Doing the joint RFP. I didn't understand the whole budget or schools question.
So there's, the governing body approves the school's budget, right? They also approve the city budget, which includes the school's budget. Plus, you'll notice that in our budget, when you look at the school's budget and the city budget, we're double counting a number. And that number is roughly the $12 million that the city gives to the schools. It's part of their budget and it's part of the city budget. And when you put both budgets together, you're essentially double counting that money. So we give them money and the governing body authorizes them to spend a certain amount, right? The majority of their funding comes from the state, right? They have their own CIP. So they have their own discretion to spend within, you're just giving them a dollar amount, right? You do have those large program areas that you can budget by, but right now, historically, all we budget for is kind of a total, right? Let's say $43 million, governing body approves, gives to the schools, and then they can do with that $43 million, that's their discretion, right? As a school board and as a school administration, they can spend it that way, right? What I'm saying here is if there's two ways to do this, we can do the joint RFP, and then the PD budget is in our CIP, and the school's roof is within their internal budget, right? Or we can just say, hey, this is a large scale facility item. Yes, we're not incurring debt on this, but it's a large facility project. We'll issue the joint RFP, but since it's our money anyways, do we just want to keep it in our CIP, the city CIP? So it's not a money that won't be double counted essentially, right? Because let's say we approve, I don't know, I'm just throwing out a number, $500,000 for the high school roof in FY22, right? That $500,000 can either be part of our CIP that, we're gonna pay the contractor with and have the school's, management team be a part of that, or we just give them the $500,000, and then at the end of the day, it's their discretion how they're gonna spend that $500,000, right? So that's another kind of thing to think about here. We're doing this jointly, what's the route that we want to go in? And again, we can't force them to, this would have to be something that they would have to agree to. So if they don't feel comfortable doing that, they would say, no, we prefer, we like the idea of a joint RFP for economy scale for pricing, but we'd rather just have you allocate the total budget to us to include that money, and then they're managing the expenditure, they're paying the contractor, all that stuff. They'll end up managing their side, and we only manage the PD side.
Okay. I agree with Councilmember Mensing. I think the city needs to be in the driver's seat with an expenditure this large, potentially this large. I think we need to be in control, actually. Okay, let's go to the folks at home. Councilmember Moore?
I agree with the joint RFP. I think the economies of scale is worth pursuing. I also think, as Councilmember Mensing has mentioned, that we should be in control of the process and show the capital budget in our budget.
Okay. Councilmember Javed?
Yes, in favor for the joint RFP. Yes, and the city control.
Okay. Vice Mayor Banks?
I agree with the joint RFP and for us to have control. I just want to mention that hopefully we're going to get the same roof, that hybrid multiple layer membrane roof that was recommended by I think Mr. Gibbons in the school board meeting, because that roof has a 30-year life expectancy versus the 20-year life expectancy of the cheaper.
Preston, what you're talking about is the Cadillac version, and in fact, Mr. Gibbons referred to it himself as the Cadillac version. The one that would have a 20-year guarantee is the second, the option B that Mr. Gibbons discussed.
Right, let's get the Cadillac option.
You want the Cadillac option?
It's a 30-year life expectancy, and versus the 20-year, I think that's better.
Well, I think our pocketbook might have to determine that. I mean, okay. Yeah. I know I've said this before, and I'll say it again. We can't have a champagne appetite with a beer pocketbook. I mean, it's just common sense. But I hear what you're saying. You want a good roof. And I think Mr. Gibbons said that the other one, because it's completely 100% glued down to the roof, is a very good roof. And he says they usually last about 25 years. They guarantee it up to 20, but if you take care of it, it will last longer. It will definitely last longer.
I want to make sure that we're betting, just like we're doing in the city hall process. Mm-hmm. You know, I like North Scott. We work very well. Right. But every time they tell me something, I look to Calvin and Kenny. What's your first opinion on this? Mm-hmm.
Exactly.
Do you agree with what they're saying?
Mm-hmm. Yeah.
Let them kind of chime in as well. They're the experts on that, and they're representing fully the city's interests. Because
they're out to sell us the roof. Right. No, I think we get that. Yeah. Okay. Also, I wanted to mention if this cannot come together by the budget time, there's always the budget amendment process that can handle this. So we don't have to feel that we're under the gun for this. Okay. So do you have, is that enough guidance, Laszlo?
To Eric and get the process rolling.
Okay.
Maybe that we have a meeting with their engineer who's helping them with this and discuss the options, have them take a look at our police as well. And come back with options.
Okay. Thank you very much. And thanks, everybody. That was a great discussion. We have no closed meeting because we don't even have Dean here. Are you still with us, Dean? Okay. Is there anything else for
I'm still here. I'm sorry. It took a second.
That's okay. No, I was just yanking your chain. That's all. Is there anything else for the good of the city?
I have a quick question.
Yeah.
Do we have a demolition date for anything? Not this building, for
like across the street?
Wherever it is.
Yeah,
Yes.
their goal was March 1st with the whole bonding issue. Well, actually, they have to do some work before, but I think sometime in April, we'll likely see demolition of these facilities.
Okay, thank you.
Okay. Anything else for the good of the city? Okay. Do we have a motion to adjourn?
Moved.
Second.
All in favor?
Aye.
Opposed? Abstained? Motion carries. We're adjourned. Thank you.